and planned ahead. Let's keep doing the right thing. Support sober driving by getting yourself and your friends home safely.
Do the right thing.
Visit arrivealive.org to find out more. Arrive Alive. Drive sober. This is Rogers TV.
Casualties, we mourn the loss of Constable Heidi Stevenson, a 23-year veteran of the RCMP who died in the line of duty during these tragic events. We stand in solidarity with the residents of Nova Scotia as they mourn and deal with this tragedy. And I'd like everyone who is able to please stand for a moment of silence in honor of these victims. Merci. Thank you. Roll call, please, Madam Deputy Clerk.
Councillor Luloff. Councillor Dudas.
Present.
Councillor Harder.
Here.
Councillor Suds.
Here.
Councillor El Shantiri.
On the phone.
Councillor Gower.
EC.
Councillor Kavanagh.
Present.
Councillor Shirelli. Councillor Eglai.
Here.
Councillor Deans. Councillor Tierney.
Present.
Councillor Fleury.
EC.
Councillor King.
Here.
Councillor McKenney.
Present.
Councillor Leeper.
Present.
Councillor Brockington?
Here.
Councillor Menard?
Here.
Conseil Cloutier?
Présent.
Councillor DeRose?
Here.
Councillor Moffat?
Here.
Councillor Meehan?
Present.
Councillor Hubley?
Here.
Mayor Watson?
You see?
You have a quorum, Mr. Mayor.
Okay, thank you. So we have the same procedures for the teleconference meeting as last time, so I think you all have a copy of that, so no need to go over that. Confirmation of minutes, adoption de procès verbaux for the meeting of the 8th of April 2020. Carried? Any dissents? Declaration of interest, including those originally arising from prior meetings. Déclaration de conflit d'intérêt. Are there any declarations? None. Communications as presented. Regrets, Councillor Deans and Councillor Shirelli advised they'd be absent from the City Council meeting of the 22nd of April 2020. Motion to introduce reports. Motion portant présentation de rapport. Councillor Moffat, seconded by Councillor Dudas, please.
That Planning Committee Report 22 and the reports from the City Clerk entitled Ward 19 Cumberland Vacancy Options, including the revised rural implication section, and summary of oral and written submissions for items subject to the Planning Act explanation requirement at City Council meeting of April 8th, 2020, be received and considered.
How's your dog, Scott?
That was not my dog. That was someone else's dog.
So on the motion by Councillor Moffat, carried. Any dissents? Well, good morning, colleagues and ladies and gentlemen who are watching on Ottawa.ca or Rogers Community 22, au Câble 23. I'll bring you a brief update on the situation with respect to COVID-19. On Monday, Chair Suds and I were pleased to bring some good news for our city, particularly for our most vulnerable residents, during an update on the good work being done by our Human Needs Task Force. The Province of Ontario recently announced that it is providing funding to municipalities and community organizations through the Social Services Relief Fund in order to support them in their response to COVID-19. Through the Provincial Community Homelessness Prevention Initiative, the City has now received $6.6 million of a $13.3 million commitment. The City also received $4.8 million in funding through the Federal Government's Reaching Home program, announced in late March. In total, we've received $11.4 million from our provincial and federal partners to help improve the capacity of the homelessness service providers and other nonprofit agencies to service clients immediately. $8.4 million of this funding will be allocated to the existing shelter system and the most pressing homelessness needs, including isolation centers, day services, and shelter services. In addition to the Routier Community Centre, this funding will help us immobilize the Jim Durrell Recreation Centre on Walkley Road to assist up to 140 men in the shelter system practice physical distancing starting on Monday. Le Patro d'Ottawa and Cobourg and Lower Town will also become a 40-bed isolation centre for residents in service homes, while the McNabb Arena in Centretown will open its showers and washrooms to the homeless this week. The remaining $3 million of the funding will be allocated to nonprofit community organizations to address their immediate and ongoing needs. These agencies must focus specifically on serving individuals and families who are at risk or currently experiencing homelessness, or provide essential services and supports to other at-risk residents and equity-seeking communities during the COVID-19 crisis. I want to include a reminder today that we are inviting local nonprofit agencies to apply for this funding. The application process for the funding opened on Monday, and forms are currently available on ottawa.ca. J'invite les agences sans but lucratif et les...
I'd like to invite the nonprofit organization and others to apply for this funding at ottawa.ca.
Applications will be end of day on Monday, April 27th, and I encourage eligible organizations and agencies to apply. My thanks to the Province of Ontario and the Government of Canada for their support, which is enabling us to support the residents in our community facing the greatest challenges during this pandemic. I also want to thank our Human Needs Task Force under the leadership of Chair Suds and Donna Gray for their hard work and dedication to helping our city's most vulnerable residents during this particularly difficult time. I want to turn my attention now to the population survey that was recently conducted by OPH. The survey gauged Ottawa residents' preparedness in response to COVID-19 and the respect of social distancing measures since they were put in place, and the results are promising. The survey showed that 94% of respondents believe that the pandemic is a serious issue and that 84% of people had changed their social behavior in response to COVID-19. Nos résidents prennent cette crise au sérieux.
They're taking the crisis very seriously and are doing the what's necessary to fight this pandemic.
And loved ones, or by socializing during appropriately distanced walks in their yard while maintaining the appropriate distance from others. In addition, only 5% of the people in Ottawa report socializing in their home or in the homes of friends and family. I want to thank residents for adhering to the advice of the Ottawa Public Health Bureau, as well as provincial and federal officials, to help stop the spread of COVID-19. The actions we are all taking are critical. Ces gestes font toute la différence dans notre lutte contre.
That would make a big difference in our fight against the pandemic.
And avoid going out, and the more we will help stop the virus from spreading within our community. And my sincere thanks to all of you for doing your part. And speaking of people doing their part, it's wonderful to see so many individuals and businesses across our city continuing to step up to make a difference in this fight. I spoke about some great examples at our last council meeting, and I want to once again highlight a couple more today. It's stories like that of resident Jordan Hardin, who started handsan.ca. Mr. Harding is an executive at a local tech company. He's still busy with his day job, but in his spare time, he's bottling and distributing hand sanitizer for free to people who are most at risk of getting COVID-19. Mr. Harding is working with Dale Hammond, who oversees the operation of the vast delivery network, and they've received the generous support of North of 7 Distillery, Ottawa Scene, and WTF Lab, as well as a number of local businesses and residents. I want to thank Jordan and his team for the exceptional work that they're doing to help protect healthcare professionals, older adults, first responders, and grocery and restaurant staff in our community. I also want to highlight the work of the Shielding Heroes campaign. The campaign started after Dr. Ana Teresa Lobos from CHIO made an appeal about the urgent need for PPE, or personal protective equipment, for frontline healthcare workers. This led to local business leader Darcy Walsh, an executive with Edelman Canada's Ottawa office, reaching out to former NHLer Brendan Bell, Danielle Robinson at the Ottawa Senators Foundation, and HP Canada's president and CEO Mary Ann Ewell. Working together, the team developed a Made in Ontario innovative face shield that received approval from Health Canada. The Shielding Heroes campaign, which is being led by the Ottawa Senators Foundation, is looking to raise $500,000 to ensure that 3,500 medical-grade face shields can be manufactured and shipped every week over the next 12 weeks to hospitals throughout the National Capital Region. Since launching the campaign last week, more than $260,000 has been raised with the help of many local companies and foundations, and I'm very grateful to all those who have generously supported this effort. More funds will be required in the weeks to come to help protect our outstanding health professionals who are putting their lives on the line to keep us all healthy and safe. I invite residents and businesses interested in contributing to the Shielding Heroes campaign to visit sensfoundation.com for information on how you can help in this important effort. This is yet another example of how our community and our residents are stepping up to get us through this challenging time together. As our community continues to do everything it can to fight the spread of this virus, I want to tip my hat to our city team. Thank you, Steve Kanalakis, Dr. Etches, to our general managers, and to every single employee that is involved in these efforts to protect and support our residents during this difficult time. I know you are putting in countless hours to assess the situation as it evolves and to plan a response in collaboration with our multiple community partners. It's a significant task at hand, but know that all of City Council has been impressed with your dedication and professionalism over the last few weeks. Un grand merci à toute l'équipe pour le travail.
A big thanks to the team for their outstanding work in the past few weeks. Thank you so much.
Now we're going to have verbal updates by Public Health in the City of Ottawa, and we'll go through all of the presentations first, and then we'll go back to our our list of councillors and ask each member of council if they have any questions or comments on anything that Dr. Etches or Steve Kanalakis or Donna Gray or Wendy Stevenson have given us. Alors, on va commencer avec le président du conseil d'administration.
So we'll start with the board chair of the Health Council, Councillor Eglai.
As a brief update before Dr. Etches shares more information with you, I'd like to highlight a few initiatives undertaken by the team at Ottawa Public Health. As you and all residents well know, information and guidance around COVID-19 pandemic seems to be changing and evolving at an incredible pace, which amplifies the challenge of keeping residents informed. Ottawa Public Health uses various channels to keep residents, businesses, community service organizations, and elected officials informed of the latest guidance. With a city as vast and diverse as Ottawa, this is no easy task. Ottawa Public Health staff have been keeping the website ottawapublichealth.ca/coronavirus up to date while continuing to develop new content that helps communicate how to best reduce the transmission of COVID-19. It's also critically important that we ensure this information reaches diverse audiences who may not use or have access to our mainstream communications. That is why OPH staff are working closely with representatives.
Keith, sorry. Someone is madly typing away. Please put your phone on mute. Thank you. Merci. Go ahead, Keith. Councillor.
Thank you, Mr. Mayor. That is why OPH staff are working closely with representatives from groups like Refugee 613, the City of Ottawa Aboriginal Working Group, Together We Can, the Somerset West Community Health Centre, and others to collaborate and ensure we are using the right channels and the right approaches to get information to those in need. This includes launching a website with COVID-19 information available in over 30 languages. Last night, the Ottawa Board of Health, with the support of OPH staff, or not last night rather, but Monday night, the Ottawa Board of Health, with the support of OPH staff, passed a motion calling on the provincial government to amend the emergency orders to allow for the safe operation of outdoor allotment gardens and community gardens. Seems kind of funny on a day when we're the coldest capital in the world, but spring is coming, and we know these gardens are an important source of nutritious and affordable food for our community. And with appropriate guidance from public health, we believe they can operate safely. Councillor Brockington is bringing forward a motion today, which I am seconding, to seek a similar endorsement on behalf of City Council. I hope my colleagues will join me in supporting these efforts. On another note, as we turn our minds to what the future holds, including ultimately relaxing some of the current physical distancing measures in place, Ottawa Public Health is working with various City of Ottawa partners to develop a strategy that makes sense for the health and well-being of our community. The strategy involves bringing together the perspectives of residents, local businesses, and councillors to help determine the path forward. I anticipate sharing more details on this engagement opportunity with my council colleagues in the short term. As always, I would like to thank our entire team at OPH and all the city employees for the dedication and hard work during these trying times. And I echo your sentiment, Mr. Mayor, in thanking all of our residents who have come together and are working together to follow the social and physical distancing rules, to contribute to various charities and volunteer organizations. We're going to get through this together, and again, thank you to all the residents of Ottawa. With that, I'm going to pass it over to Dr. Etches.
Thank you. Yes, thank you. Good morning. Bonjour, Quay. I have some slides that I've given to council, and I believe that they are also going to be projected. So just to say then that I'm starting with slide number 2, which is called Our Approach to the Pandemic. We are taking the same framework that we need to bring the disease under control, that we have our non-pharmaceutical interventions, which include the physical distancing, that are playing a key role. We know that along with that, we need to support our community in various ways. I'm happy to answer any questions about operational aspects of our response, though that was more covered in detail with our Board of Health. And I will discuss the plan looking forward and how we're working in collaboration with others. So going on to the third slide, I am happy to say that we have expanded testing capacity in our region. We're up to being able to do 1,000 tests a day. And this comes along with the ability to prioritize more groups. So our website and the slide highlight that the number of priority groups that can be accommodated has grown. We encourage people to check the website if they have any symptoms of illness that could be related to COVID-19 to present to be tested, or if they need support because they can't leave their home very easily, that this is something that we have other systems to facilitate testing, and they can reach out. I will say that as we continue to try to test as many people as possible, we have to continuously calibrate what we're doing because there are other pressures for testing that are coming from long-term care homes and retirement homes, and so it's a delicate balance. But we continue to ask people if they are in one of the priority groups to present for testing. So I'm going on to slide 4. Speaking of all the testing, and we usually, daily we report on the number of positives that we've seen out of those tests. I can tell you that we're up to 899 positive tests, and people are wondering, have we peaked? Will we peak? When will we know? And so this slide is about hospitalizations and intensive care unit trends, because that is a more reliable picture of what's happening in our community with the rate of infection. A certain proportion of people will always get more severe illness, unfortunately, and present to the hospital. And the good news here is that we do see that the hospitalizations have been stable. To the eye, it looks like there's a decline recently, and that's good. My epidemiologists tell me we can't say it's statistically significant yet, but this is the kind of information that we'll be able to say we've peaked when we see the hospitalizations decrease, and certainly over an incubation period of 2 weeks will be very, reassuring data. Hospitalizations do lag about a week or so from the lab-confirmed results, and so this picture is very similar to the picture across the province of Ontario, where the Premier was talking about having seen the infections peak. So that's the general population testing. On the next slide, slide 5, of course, there's a different picture I want to highlight that's very important in our long-term care homes. And so this slide shows of all the long-term care homes, we've now had, 25 to 30% or so have had an outbreak. Some of them have resolved their outbreaks. I believe we have 4 outbreaks in long-term care homes that have been resolved, and there are others ongoing. This is a population that's more vulnerable. Of the 25 deaths that we've seen due to COVID-19 in our community so far, 16 of those have been related to outbreaks in long-term care homes or retirement homes. And so I do have a second slide that shows the retirement home on slide 6 environment is not seeing the same increase, in terms of the percentage of homes affected. In both cases, it is the majority of homes that have managed to prevent spread of infection. And I want to commend the teams of long-term care home owners, operators, staff that are working hard to continue to try to prevent outbreaks and then control them. On the next slide, 7, I will speak to the fact that this is a big undertaking, and it's hard for long-term care homes to do it on their own when they have staff that have to be off because they're ill and other pressures. And so the province's provincial action plan is accelerating the measures to support long-term care homes. They are fast-tracking efforts, working with Public Health Ontario hospitals, public health units, to really support long-term care homes and retirement homes with aggressive testing, screening, and surveillance, managing the outbreaks and the spread of the disease, growing the long-term care home workforce, and ensuring that critical supplies, including personal protective equipment, is available for all staff. And so locally, what this means is that we are seeing excellent collaboration with the hospitals across the region, with other healthcare providers who are working together to, contact homes, offer specific support. This has been happening over the weekend for 4 care homes, for Carling View Manor, Madonna Long-Term Care Home, Laurier Manor, the Mall 4 Long-Term Care Home. People have received support with staffing and personal protective equipment, and we're going from there. So the idea is that long-term care homes are in the highest need due to the nature of the populations they serve. You can imagine where there's a floor of people who are living with dementia, that it is very hard to self-isolate people in a humane way. And so this is the focus to protect those most vulnerable, and we're moving out from there, going on to support retirement homes, also other settings where there's congregate living, like group homes, shelters, rooming houses. Ottawa Public Health has been involved in providing guidance to all of these settings and will continue to do so. On the next slide, slide 8, I'm talking about non-pharmaceutical interventions. So the physical distancing is still critical to maintain. People have definitely, and rightly so, turned to think about how we can relax some restrictions safely. We need to plan very carefully for that, but it is not the time yet to actually implement those plans. We need to be very careful because most of the population has not been exposed to COVID-19. Most of the population is not immune, and so anything that increases our interactions with others can increase transmission of the virus again, potentially undoing the work, the hard work that everyone in Ottawa has accomplished so far, and so we're going to be very careful about that plan. The discussion at the Board of Health on Monday did include the importance of an additional layer of protection for others if people are wearing non-medical masks, face coverings when they're out and they can't maintain a 2-meter distance from others. And we've heard that people are having trouble accessing that supply. We would like everyone in Ottawa to be able to access these non-medical masks. And so that is an initiative that we're continuing to promote. Donations to COVID donations at toh.ca. That's COVID donations at toh.ca. If people have masks that they've made and they'd like to donate or different ideas, please be in touch. This is in the context, of course, of recognizing that our healthcare workers need medical masks. And so we still need to prioritize healthcare workers using the medical mask. Turning to slide 9, when it comes to supporting the community, we know that people are finding the physical distancing challenging, and so we are continuing to work with mental health partners and promote, with a dedicated site on our website that pulls all of the resources together, the supports that are available to people. There are, of course, if people are in crisis, the distress center, but many other virtual supports that our healthcare partners are now providing. And one that definitely is worth highlighting is a chat or text service for women who may be concerned that they're in an unsafe environment. Likewise, children are a priority. We're concerned, and we're working with school boards, with CHEO, with the Children's Aid Society, to be able to proactively reach out to families where we think there are some signs or concerns that they may need more support. I will highlight on this slide that substance use also is an issue that could impact the health of the population right now, as people are reporting in surveys done by the Canadian Centre for Substance Use and Addictions that the amount of alcohol they're consuming has increased, and that is, of course, potentially linked to more concerning behaviors. And we know that we're just it's worthwhile asking people to monitor their intake and to think about what else can be done to cope with stress. And potentially, that is something that if people do want more support on, if they're finding they're getting into trouble with that consumption, that there are also services available. I would encourage people to continue going to our website because we are always building new resources for specific populations. The chair mentioned in many languages, but also dedicated for businesses, dedicated for workplaces. All of these audiences are important, older adults as well as youth. So I'll turn to slide 10, which is about looking ahead. And I want to spend a little bit of time going through something a bit more on the testing of COVID-19 because there are a lot of questions about the kinds of tests that are available and can we use something that would tell who's immune or who's not? And, what about these point-of-care tests? So in addition to the testing that's being done now to detect the virus, an important surveillance system tool would be to test people for antibodies against the COVID-19 virus. And that would show who's been infected. And if you have the antibodies, you're likely immune. We don't know for sure if you are completely or for how long. But this is a piece of work that the province is organizing to be able to have that picture across the province. It's important because we need to be able to monitor the level of infection in the community as we talk about relaxing restrictions. The goals of testing for COVID-19 change over the course of a pandemic. To begin with, the tests that we used were for diagnosing someone with an infection, and they were to detect early cases, to detect the transmission, the entry of the virus into our community. We focused on travelers. And then we added a focus on identifying cases in high-risk settings, in hospitals, in long-term care, in healthcare workers, for people who needed to be back at work. For the rest of the population, we've relied on self-isolation and physical distancing to keep people with COVID-19 infections in the general population from passing them on, so without a need for a diagnosis. Ideally, we'll keep increasing the testing capacity to be able to find the COVID-19 cases in the general population and then use our case and contact management as effectively as possible to prevent transmission in a more targeted way. But keeping the rate of transmission low will continue to require some measures of physical distancing. So, as mentioned, the next type of test to be available is a serology test for antibodies. It will be less useful for diagnosis because it takes a few days to a week for antibody levels to become detectable once someone's infected. So the virus detection test shows if someone's infected sooner. And when people speak about the point of care or rapid COVID-19 tests, they're often referring to these serology tests. The point of care tests that detect the virus are also being developed. And none of these tests yet are available in Ontario to the point of being a useful intervention tool. Most of them are still being validated. In some cases, countries have had to cancel their rapid testing programs because of false negative rates being too high. So apart from having the surveillance and the testing capacity, the way we're looking at approaching a relaxation of restrictions is that there are certain criteria, certain things that need to be in place that would give us confidence that we could do this more safely. The disease transmission needs to be under control. And so I mentioned we're following the hospitalizations. We're looking at decreases in that as a sign that there's decrease in infection in our community. We need our healthcare system to be able to detect and test and treat everyone, and that hotspots are minimized in vulnerable populations, so long-term care homes, retirement homes, group homes. We need to know that schools and workplaces and others that are going to recommence some activity have established preventive measures and are looking at doing things in a new way that prevents more transmission from happening in those settings. We need to keep an eye on the measures to stop new cases from being imported. So to think about travel and how we can manage any importation of cases. And the community needs to be engaged. We need to have a good engagement and conversation with community, through counselors, with community agencies, with different populations, old, young, businesses, private sector, all of this, to be able to understand collectively what precautions we need to take, what the priorities are, and how we learn to live under a new normal. So I will, be happy to answer any further questions about that. This is clearly a piece of work that involves federal, provincial, and local level governments, and the community engagement strategy that we'll be undertaking will be done with the City of Ottawa, as there are many different aspects to consider together. Also, just for those who may have it in their minds, we are working with the public health colleagues that we have across the river in Gatineau, and we understand they're taking direction from their province about how to relax restrictions safely, and so we'll be coordinating and communicating as much as possible, knowing that our population is very much connected. So I want to end on slide 11. I want to end by thanking everyone for their continued dedication to supporting others during this pandemic. I'm very impressed and inspired by the way people are caring for each other, and I thank you, everybody, for doing their part to keep the transmission of COVID-19 in our community under control. Thank you very much. Merci.
Great, and thank you very much, Doctor, for your leadership as well, and that of your colleagues. So now over to City Manager Steve Kanellakis for COVID and flooding update. Mr. Kanellakis.
Thank you, Mr. Mayor. The slides aren't up on the screen, so I don't know if people can see them. So I'm going to be a little bit more meticulous in terms of going through my slides for the benefit of the people that may not have them from the viewing public. Thank you very much. I want to start by thanking all city staff who are continuing to rise to the challenge to meet all of our service demands that we have and to plan for the future. Plus, they're dealing with their own individual situations, whether they're working from home or having to come into work. Everyone has a unique story to tell, and I'm just so impressed with their commitment to still continuing to deliver services that our residents depend on. So a huge thank you to them before I start. One of the presentation today is a little different than the one I gave last time in that the situation is evolving, and we're also evolving our emergency operations from a response posture to a recovery posture. And that is a significant shift for us in terms of us now focusing our attention on the look ahead and what's coming, working with Ottawa Public Health and the various other levels of government that we're engaged with. And I wanted to start on my first slide to give confidence to Council and to our public that one of the themes that is always prevalent in any emergency, regardless of how long it lasts, is our communications and what we're telling the public, what we're telling Council, what we're telling our staff and the media. And that is a central focus that we have been paying attention to. The communications activities are managed through our Emergency Information Center, which is part of the Emergency Operations Center, now that we're in a state of emergency. And it coordinates all information from all departments, EOC, Public Health, and our external partners at the Ottawa Hospital. And we are updating city channels in real time 7 days a week based on the new information we received. We're giving regular updates to the city's various communication channels. We're public broadcasting through regular media availability. City Council, Ottawa Board of Health meetings are available on YouTube. And we're announcing all new initiatives and special announcements through memos, city communication channels where applicable. And from day one, we always had in our toolkit the council liaison role. And from day one, I firmly believed, based on the way this was going, that we needed to expand that role. So we really staffed up our council liaison role so that it was able to respond to council and council offices from their own inquiries and from their constituent inquiries. And we've also added that function to the Human Needs Task Force because a lot of inquiries were coming into that. So we created a group of people who are dedicated to responding to our councillors and constituency needs, and they've been doing an outstanding job responding on a daily basis. And on my third slide, I want to give you a sense of the numbers. Our council liaison function has dealt with 870 inquiries from councillors. Our human needs task force has dealt with 100 inquiries from councillors, and Ottawa Public Health has dealt with 627 inquiries for almost 1,600 inquiries total since this started just over a month ago. Our top themes are, number one, access to parks and playgrounds. Number two, closure of non-essential businesses and services. Number three, housing, shelter, and supports for our most vulnerable. Number four was enforcement of closures in the Quarantine Act. And number five, the ongoing public health measures such as physical distancing, self-isolation, guidelines, testing, and guidelines for multi-use dwellings. And this does not include the call-outs. One of the things we've added to the council liaison that I felt was important was our council liaison divide up the councillors and call councillors directly on a weekly basis to ensure that we are hearing what their needs are and we speak to them personally. And this doesn't include these numbers, the hundreds of calls staff have with individual councillors, either staff calling councillors or councillors calling staff to make inquiries on specific issues. On slide 4, I want to give you a little sense by the numbers. City of Ottawa and Ottawa Public Health website visits have totaled almost 2.3 million since this has started. Our social media posts have been over 13 million. The City of Ottawa and Public Health social media posts have been 2,261. We've issued 84 products, which are feature stories, public service announcements, memos from departments on specific decisions that have been made by the OC, specific actions that have been taken, specific changes to legislation and announcements, media advisories, and news releases. We've had 24 media availabilities led by City of Ottawa and Ottawa Public Health. 440,000 residences have received the direct mail-out that Public Health sent out that we supported. We've posted over 5,000 signs in parks, and we've had over 5.6 million hits on print, social media, and digital. And our media inquiries have totaled 249. I can tell you that in our inquiries, we are 90% closure on the inquiries we received from council. So we're tracking those really hard. I want to turn my attention to slide 6 on the way forward. We've continued to focus on emergency response and planning to sustain and recover and rebuild services. And now we're shifting into recovery in the rebuild phases of the pandemic. And with that, our senior leadership team and the OCG have decided that we need to add 4 more task teams to our structure, our emergency management structure, because we need to focus on the future. We can't get caught not being prepared as the economy starts opening up and announcements start coming from the province and from the provincial and federal government. And the context for this is that residents are looking for city services to assist them to getting back to their everyday lives. And I think that right now the definition of normal will change for a while, as Dr. Etches said. What that will look like exactly will evolve, and we're trying to figure that out as our other levels of government. And we are working very collaboratively with the federal and provincial government bureaucracies and other large cities across the country to provide input and feedback in terms of which sectors may open first, what may be the impacts, and what are the things that need to be in place for them to be able to open, and how do we respond as a city to be able to support that opening of the economy and opening of our services from a staff perspective. So our focus right now is on human safety, supporting our employees, maintaining appropriate city services to our community, and sustaining the economic resilience of our organization in the city. On slide 8, I have a revised structure that is now the Emergency Operations Center, which is, as you can see at the top, is headed by the Emergency Operations Control Group. That is the team made up of all the general managers of all city departments and myself chairing it, with the police chief, fire chief, paramedic chief, bylaw chief, CEO of the Ottawa Public Library, medical officer of health. Are all at the table, and sometimes the hospitals and other external agencies also join us. And the way it's structured is that we have basically 4 key sections: operations section, planning, logistics, and finance and administration. The Human Needs Task Force is under the operations because that's evolving and emerging issues every day. They are literally adjusting hourly to changes, to legislative changes, to issues emerging in our community. And the Human Needs Task Force, which is led by Donna and Claire Friere, who's the key lead on behalf of the department, and our community partners are under the structure of the OC. We've now added 4 task teams: a people task team, a finance task team, a services task team, and an economic recovery task team. And I want to take just a couple minutes to explain what the role of each one of these are before I turn it over to the next presenter. I'll start with the people task team, which is slide 9. Valerie Turner is the executive sponsor of this team. She's the general manager of Innovative Client Services, and her role really is to preserve, protect, and optimize the deployment of our staff and support our staff as we enter into the new opening of the economy and as our services start to come back. So she's focusing very much on what the workplace will look like, what the health and safety needs will be of our employees. How do we normalize work from home and support productivity, mental health and employee assistance programs and other supports our staff are going to need as they come back? How do we strengthen our relationships and ensure consistency across our bargaining agents so that we are consistent in how we apply our policies and practices in the workplace? How do we evolve our needs in terms of workforce analysis, HR policies and process? And how do we ensure our staff feel confident that they can come back to work, the ones that are going to be coming back into the workplace, that they can come back feeling safe so that they can do the jobs we so needly, badly need them to do. Our next task force on slide 10 is our finance task team, and Wendy will be providing an update on our finances immediately after my presentation. And Wendy Stephenson, our Chief Financial Officer, City Treasurer, is executive sponsor, and her mandate is to look at the 2020 budget and develop a financial forecast and recovery plan for 2021 budget cycle and beyond. Everyone is focusing on the economic hit and the financial hit to businesses and governments, and from my perspective, the city, in terms of what's happening in 2020 and what we need to do to close the gap in terms of the deficit we're running versus the expenditures we have and the increased costs we have in some cases. The real issue is going to be 2021, and how do we go into 2021 and what assumptions have to change that we've been making in terms of our long-range financial forecast and in terms of the assumptions on budget pressures, et cetera, and revenues that we've made and are forecasting into the future. Those have to be revisited, and Wendy has a team that is focusing on this year operating and capital budgets, and will be focusing very much on 2021 and 2022 to give council a line of sight in terms of where are we going and what adjustments do we have to make in terms of not only our initiatives and work plans, but in terms of the financial decisions council have to make. The third task force is the services task team on page 11. Slide 11, Dan Chenier, our General Manager of Recreation, Culture and Facility Services, is the executive sponsor. And Dan's job is to look at all services in the city and develop a recovery strategy so we can resume operations in a phased and thoughtful approach. And that is a very complicated function to do. He's going to be working and has a integrated team of all representatives from the departments to look at how do we open up and how do we make it safe for employees to be at work and for our residents to have contact with their employees in the work environment and to still deliver services virtually and maintain some of the structure that we've set up to date. So Dan's going to be coordinating and prioritizing our external supply and service and supply chains that support us. He's going to be aligning the strategy and deployment of staff, and he's going to be looking at reestablishing department plans and service plans so we get back into business and reopen all our facilities that have been closed. How does that happen? There's a lot of thought that has to go into that. And the fourth team is the Economic Recovery Task Team, which is sponsored by Steve Willits, our General Manager of Planning, Infrastructure and Economic Development. And Steve's job is to really look outward into the community and to develop Ottawa's economic relief and recovery strategy ensure we have alignment with our federal and provincial partners. We're talking to them on a regular basis, and they're asking for our input on how they're going to do that, and continue to engage Ottawa Public Health, who's part of this team, to ensure that we can support the opening of the economy. For example, residential and public projects, the whole construction sector coming back. Steve plays a big role with his inspectors, his officials, his planning department people, his right-of-way people, all the permitting people. All those people have a huge role in helping our businesses get back up and running and supporting them and playing the regulatory role that we'll be asked to play. And we're also doing an economic sector analysis to identify which sectors need different support so we can be strategic about how we support the different economic sectors. And we're doing that, as I advised last time, with 5 other major cities in Canada, where we're looking at sector-by-sector analysis, so we'll have more input to provide to council and a better view and line of sight of who's struggling and who's getting back on their feet quicker. Steve will also be looking at our legislative priorities, so city strategic plan, official plan, transportation master plan. We have big bodies of work. This was supposed to be a huge year for policy and legislative agenda. Steve has to look at that because we need to be able to advise council on which projects we're recommending to continue and which ones have to be deferred, or what adjustments have to be made to be able to deliver the priorities in our strategic plan and the other major policy pieces that council was expecting us to move forward this year. And we're concerned that some of these may not be possible to move forward, but we need to take a hard look at that so we can plan the legislative agenda for committee and council going forward. Now, Mayor, would like to turn it over to Wendy Stephenson, who's going to do part 2 of my presentation on giving a financial update on the financial impact of COVID-19. Thank you very much.
Okay, thank you, Wendy.
Thank you, Steve, and good morning, Mr. Mayor and Council. Today I'm going to provide an update on the city's financial impact of the COVID-19 pandemic, with a focus on the review that we've completed with respect to expenditures and forecasted savings. Moving on to slide 14, which is the financial scenarios. So on April 8th, I provided Council with a summary of the forecasted revenue shortfall and some examples of the cost impacts. We now have a more comprehensive analysis of the cost impacts, but it's also really important to note that the update today is based on what we know so far. These numbers are subject to change as we gain further insights and experience in operating in this new environment and maintaining our essential services while requiring physical distancing. The most significant impacts on the city's budget is the closure of the recreational, culture, and community services, as well as the library branches. This has had an impact on our revenues, and it's also resulted in some reductions of our operating costs. Transit ridership estimates have also been significantly impacted on, and they're reflected in our forecast in terms of shortfalls in revenue. We're currently assuming the worst case scenario in terms of 100% fare reduction starting in April. However, once we obtain the actual results for April and analyze those, we'll be able to provide a more accurate forecast in terms of what that fare revenue reduction is going to look like going forward. And these revised estimates will be provided in our next financial update. Other assumptions that are built into the estimates that I'll be presenting to you today include reductions in our parking and parking ticket revenues of 30% and approximately 67% respectively. The financial impacts presented today are based on the 3 scenarios that we discussed at the last council meeting. Scenario 1, where we return to more regular operations occurring in June, and scenario 2 assumes a return in September, and the worst case scenario, which is scenario 3, which is a return to normal at the end of December. So throughout the presentation this morning, I'm going to focus on the medium impact scenario, which assumes a September resumption date. And my presentation is based on 3 areas. We're going to focus on the transit budget, the tax-supported services, and the rate-supported services. We're on to the next slide, which is the transit impacts. So starting with transit, it's important to note that these numbers reflect the financial impact of COVID on the city's budget. It's not an estimate of the city's overall operating deficit at the end of the year, as there's some additional financial pressures or savings that will be generated throughout the year as part of our regular operations. For transit services, the most significant impact is the reduction in the fare revenue, which is estimated to be $99.4 million if the pandemic continues until September. There's also some cost savings, particularly in the reduction of the Presto fees due to the drop in the Presto sales, the reduction in paratransport contract costs due to significant reduction in para bookings, and reduced overtime and fuel savings due to the reduced bus hours. Some of the initial discretionary cost savings have also been identified for a total forecasted COVID-related transit deficit of $83.8 million for Scenario 2. So moving on to the next slide, which is the financial impacts on the tax-supported budget. For tax-supported services, the most significant impact on is revenue on the closure of the recreational facilities and the community centers. The estimated reduction in revenue for these facilities is $38.9 million if the pandemic extends to September. Our investment market has also been very volatile over the last few months, and it's very difficult to predict the investment returns in this economic environment. But according to our most recent current market analysis, our investment income could drop by approximately $5.1 million under Scenario 2 due to the lower returns and deferral of taxes and other revenues. An additional impact on the revenue of tax and water bill deferrals is a reduction in our interest income and our user fees. Other areas that could see a drop in revenue is parking and parking ticket revenues for a combined shortfall of $16.2 million under Scenario 2 and Provincial Offences Act and red light camera revenues. The total forecasted revenue reduction for tax-supported services is estimated at $70.4 million under Scenario 2. Moving on to the next slide, I'll speak to some of the savings that we may see and increased costs. So the closure of the facilities and the reduction of non-essential services will generate some savings, but the cost of responding to the pandemic also has increased costs in other areas. Casual and part-time staff that were working at the closed recreational facilities have been placed on declared emergency leave, and the cost savings associated with the facility closures are primarily related to the compensation and facilities operating costs, such as materials, services, and utilities. Since there is a projected reduction in transit fare revenues, we're also forecasting a reduction in the fare subsidy required for Equipass and ODSP bus passes. Some of the non-essential services related to parks, roads, and forestry will also achieve some savings, primarily in salary costs. There's also a forecasted decrease in costs due to the possible cancellation or deferral of the hazardous waste depots, and this is really dependent on when those services recommence or resume. The key areas that we're expecting additional costs related to COVID are primarily for paramedics, fire and emergency management of overtime, leave and equipment, staffing costs in long-term care facilities to provide our 24/7 coverage, and higher housing subsidies for individuals experiencing reduced personal income, and increased collection costs for the in-house group due to the increased residential garbage tonnage. The total estimated net decrease in costs for tax-supported services for Scenario 2 to September is approximately $30.2 million. And we're moving on to the summary slide for tax, and this slide summarizes the total forecasted deficit for tax-supported services. It excludes public health, police services, and Ottawa Public Library, which report separately to each of their boards. I can tell you we're working very closely with our partners to ensure that we're sharing all of our reviews and our financial strategies with them, and we are working hand in hand to reduce the gap. The total estimated deficit due to COVID for the tax-supported operations is approximately $35.8 million under Scenario 2. Public Health is currently estimating a COVID-related deficit of $3.8 million to September, and Police is estimating a $1.4 million deficit due to COVID and a $5.9 million if the pandemic extends to December. Library continues to track the revenue and cost impacts, and they'll likely see a net reduction in costs due to the closure of the library branches. We'll move on to the next slide, which provides a summary of our rate-supported services. And here you'll see that the impact is much lower. We are projecting some reductions in water billing revenues. Overall consumption is expected to decline due to the closure of non-essential services. The forecast reduction in rate revenue under Scenario 2 is approximately $5.2 million, with a reduction of costs of approximately $1.6 million, primarily due to the reduction of non-essential services and service contracts. There's some small discretionary spending savings that have been identified to help offset the overall deficit. And the estimated deficit for the rate-supported services due to COVID is approximately $3 million under Scenario 2. We'll move to the summary slide. As mentioned earlier, the most significant impact of COVID on the city's revenue budget is the loss of transit fare revenue and the closure of recreational and cultural facilities. The impact on expenses will fluctuate as the city continues to respond to the pandemic. The demand on staff resources, requirements for additional equipment, the PP&E, and services to respond to this emergency, the support that we provide to our community, and a multitude of other operating and economic factors will have an impact on our costs going forward. At this time, we continue to forecast a loss of approximately $30 million in revenues per month, which equates to about $1 million per day. The $30 million per month in lost revenue is offset by approximately $11 million per month in cost reductions and savings. However, we do have additional costs of approximately $5 million per month, and that gives us a net burn rate of approximately $24 million per month as we move through the pandemic. We'll move to the next slide, next steps in our financial strategies. So in terms of next steps, we're going to continue to build on the work that we've done to date to identify reductions in discretionary spending, redeploying staff where they're most needed to best leverage the resources that we have, and to delay staffing wherever possible. Our current focus is to secure backstop funding and one-time grants from other levels of government to address our shortfall. In the meantime, we're also looking at our planned capital projects for 2020 to see if any can be deferred and if any projects that are currently listed as work in progress can be closed and any remaining funds can be returned to our reserves and can deal with our forecasted deficit. This analysis of possible funding and financing options will be completed over the next few weeks, and we will develop a set of proposed financial strategies that are going to be presented at a later date. And as Steve mentioned in his presentation, we are looking forward to understand the financial impacts flowing into 2021. And it's really important to note that what we talked about today are really early estimates, and our situation is still very, very fluid. This concludes my update on the financial impacts of COVID-19. Thank you very much.
Thank you very much, Wendy. Steve, is Donna giving a presentation?
No, Mayor, we had thought about, but because we did the media avail on Monday and Donna sent out two comprehensive updates on the Human Services Plan, we felt that we wouldn't do it today.
Right. So, Councillor El Shantiri on the flooding, please.
Thank you, Mr. Mayor, and good morning, my colleagues. First of all, thank you for the opportunity to give you a little bit of update on the spring freshet. Obviously, we have some good news. As I mentioned in our last council meeting, I'm working closely with staff to monitor and respond to the freshet this year. I watched firsthand the sandbag being filled and preparation for the freshet, and I'm pleased to see how staff adapted to the physical distance requirement this year. Those filled sandbags have now been deployed in the low-lying areas for the residents to use. In terms of water level, they continue to decrease along the main of the Ottawa River, which is building capacity within the river that seems to support the continued melt north. As you can see this morning, if it's minus 15 in Ottawa, it's probably minus 20 up north. And we were told 60 or 70% the snow up north still has not been melted yet. Those are good signs, Mr. Mayor and colleagues, and we do not foresee significant flood condition at this time, but if forecasts change, we have the ability to call on the military to support our response if it's needed, as we will not be able to bring together volunteers the way we did in the past years. Our staff continue, Mr. Mayor, to monitor the situation closely along with the Rideau Valley Conservation Authority and the Ottawa River Regulation Planning Board. I would like to thank my council colleagues, especially Councillor DeRose and Councillor Kavanaugh, for the leadership they're showing in getting out information on the freshet to the community. I'm happy to take any question, Mr. Mayor. Thank you.
Okay, thank you. Councillor Suds has a direction to staff. Councillor, if you want to introduce that now, then we'll go to questions.
Excellent. Thank you, Mr. Mayor. I think as we've heard through the updates this morning, there's many challenges that the city is facing as we start to turn our attention back to the economic recovery. I think we're incredibly fortunate in Ottawa to have literally hundreds of technology companies and thousands of high-tech workers throughout the city that really are at our disposal as we work towards recovery. So I think as we look at this recovery, as we turn our attention to it, we have the opportunity to leverage this expertise to help us address some of the challenges that we face, which could result obviously in better outcomes, safer, resilient, and efficient return to work. So the city currently has an innovation pilot program in place that accepts the applications for piloting of new technologies. I believe we have an opportunity here to leverage that program, but perhaps to be a bit more specific in what it is that we need. We need solutions and technologies that will help us support our recovery efforts, and that truly needs to be the focus of the program moving forward. So given this, and having spoken with staff about this previously, I'd like to direct staff to explore this further, specifically that staff explore using the Innovation Pilot Program to issue a challenge to the local technology community to bring forward innovations and solutions that would support the city's recovery efforts. Thank you.
Okay, thank you for that. Any objection by members of council to that direction of staff? And staff are agreeable. Okay, thank you very much. So now we're going to go to questions and comments on the three presentations that we've had, and we'll start based on the roll call sheet. Councillor El Shantiri.
Thank you, Mr. Mayor. And Mr. Mayor, Dr. Vera did a great job on Monday explaining to us the return to what's so-called normal, if that's the term we want to use, but to the return to start opening some of the economy and some of the businesses and some of the community center in the city. I would like to have Dr. Vera take us a little bit what that picture is going to look like. And I know you did a great job on Monday, so I'm hoping if you can summarize it to my colleague, to myself, as a councillor who co-chaired the economic task force with the mayor, we get a lot of questions about Kingston, what they're doing, or other municipalities, what they're doing. And I know we have to follow the provincial emergency management, but what is your plan for the city of Ottawa, working with other colleagues in the public health sector to take us to the next level?
Thank you for your question, Councillor. What we know is that there's harm being created by the direction right now to stay 2 meters away from others and to not gather in more than 5 and to not operate non-essential businesses because people are experiencing financial strain and they're not being able to connect socially. That's important for health. So we want to safely move towards something that is more manageable over the long term. And my approach is to work with the province to understand what they are thinking, in terms of different sectors or different types of work that could go forward in a safe way. I'm promoting a risk-based approach so that if you think about it, every expansion of our activities where we bring ourselves into more contact with others carries a risk of transmission of COVID-19. And some of those types of activities will cause more risk than others. If somebody's outdoors working and they don't come into contact with anybody else, that's much less risky than if we open up a setting where people are side by side in large numbers. And so we want to look at the nature of the risk, and we also want to look at how we can mitigate that risk. So if there's a higher risk to that industry or that activity, is there a way we can decrease that risk by operating differently? Can we look at physical distancing in the workplace, continuing to promote working from home, all of these things? So I think there'll be some consistency across the province because most of these, risk assessments are going to apply across the province. But we are different as a city. We have a higher proportion of people that are in public service. So, we still need to think about what it means for us here in Ottawa. The other thing that is on my mind is to build in the feedback we're getting from people in our community. And the kind of thing that I've heard about the most so far, and we haven't done a formal engagement, which we will, is to think about the open spaces, the public spaces that people would like to have to get out and be physically active. And I've heard some great suggestions also around a slow expansion in the household bubble that we've been trying to maintain around each of our households. So there are individuals, older adults, who have been really trying to do their part and just keeping to themselves so that they aren't at risk to others. And the idea of a pandemic buddy has surfaced so that, maybe that one older adult can have another that they can then have social support across, two households. It becomes a broader household of two. These kinds of options are reasonable, and they make a lot of sense to be able to still provide some protection, but make the response more sustainable. The same for two households where, potentially children want to play together. So these are the kinds of things that we're talking about, we're exploring. I'm telling you, it's still not time to implement, so that's we're not there yet. But please, these ideas are good to keep feeding in, so that we can have a plan that makes sense to everyone going forward. The other, kind of conversation here that's important is that there are values involved. So there are some facts we can try to collect about the risk to different behaviors or industries, but there's also values. And one of the values that I've seen in our community is that we want to protect the most vulnerable. And that means, right now what we're seeing is people in long-term care homes and retirement homes who are at most risk of death, and we want to protect them for a longer period of time, as much as possible. And so that is also part of the thinking. As we go forward, we want to think about who's most at risk and vulnerable, and how do we protect those populations in an ongoing way, and how do we do this fairly. So I hope that covers some more of the ground that you were hoping I could speak to, Councillor.
It did. If I may, Mr. Mayor, thank you very much, Dr. Atchett, for your insightful and really helpful information, because we get a lot of questions from our business community, and that really shed some light. And and on the return. Mr. Mayor, I don't have a question to the city manager, but I want to thank all the general managers and the city manager and the liaison, because they were available to us at all times. I know we didn't have a flood, but I have to tell you, being prepared for one, it helped us a lot, and it helped our community on the waterfront tremendously. Knowing the city, even during COVID-19, they still prepared to help the community in the flood. And I want to thank you, Mr. Mayor, for your trust in me to work with our city staff. And I want to say thanks to all the staff who help us with we're not over yet, but at least we are in good shape. Thank you, Mr. Mayor.
Great, and thank you, Councillor, and appreciate you passing along the thanks to Councillor DeRuse, who's dealing with the Cumberland ward, and Councillor Kavanaugh in her ward. Next is Councillor Eglai, please.
Thank you, Mr. Mayor. Yes, I also want to thank all the senior management for the work they're doing, especially the city manager. I've reached out to him several times, different times a day, different days of the week, and he's always available to take a question or a comment. So thank you for that. On that, I do have a question. We had spoken during the update, the public health update, around the efforts that have been made to put information online in a variety of languages. We continue to struggle with the use of our public spaces, especially parks. And Mr. Kanalakis, while I understand it's probably not practically or economically feasible to have signage made up in 20 or 30 different languages, are we working towards perhaps an infographic type of sign to be put in the parks that people could understand regardless of what their native tongue is to get that message across?
Thank you, Mr. Mayor. I know there's been an incredible effort by Ottawa Public Health on their website and the material and their public information media relations team to translate in multiple languages. There's a big effort going on right now to reach those hard-to-reach communities. And so that is ongoing, and I forget how many languages they're translating it in, but it was dozens. I'd like to ask Dan Chenier, because he's been leading, and Kevin Wiley, they've been leading the initiative to sign the parks and to look at all that. So Dan or Kevin, do you want to offer your comments on where we're at with that?
Sure, Steve. Mr. Mayor, it's Dan Chenier. Yes, we have an infographic, a different infographic than the 5,000 signs that were put up. I will be circulating that to members of council later this morning. The infographic focuses a bit more on not so much the park closures, but the types of activities that people are discouraged from doing. And it's all infographics. There are no languages, so it speaks to the messaging we've been getting that in some communities the English and French signs are not understood. And we will have that infographic circulated to members of council as soon as council is over.
Thanks very much for that, Mr. Kennedy. Will we be putting those up in the parks as well, or will we be just using social media?
The first wave is for social media, and we may look at some targeted. We've had through bylaw services and through other sources some indications of the locations where we've had those issues. We can look at perhaps a limited run of those signs to address specific areas where we're getting that feedback.
Okay, thank you very much for your efforts.
All right, anything else, Councillor?
No, that's good. Thank you, Mr. Mayor.
Great. Thank you very much. Councillor Tierney, please.
Great. Thank you very much, Mr. Mayor. And it's great news about those infographics, Dan. That was a question I actually had, so that's great news. On the Parks and Rec side, currently all the Parks and Recs, we're not taking bookings before June 30th. And I don't know who's best to answer that. Are we still on track for that, or do you think things will start, it may go further than that?
Mr. Mayor, it's Steve Kanalakis. No, we have not made, to the council, we have not made a decision on that yet. We're now waiting to see what the province is going to be directing in terms of the expansion of or the opening up of the economy and social distancing, relaxing that. And so we are watching that. We talk every day as the Emergency Operations Control Group. It's on our agenda in terms of that timeline. Right now, we put that out there as most other cities have to give people a line of sight in terms of what to expect. But the moment we know that we're going to be relaxing that, we'll be announcing that first to our council. But as of now, we're still looking at June 30th, not issuing permits.
Great. Thank you very much, Steve. And my next question is for Dr. Etches. Great job, by the way. And obviously top of mind is a lot of our seniors' homes in my neck of the woods. Laurier Manor, for sure, is a concern. But I did see something this morning, and I know you probably talk to the province, if not daily, hourly, about Ontario's going to do proactive COVID-19 surveillance testing in all nursing homes, immediately testing all residents and staff in homes with outbreaks, and testing homes with non-symptomatic residents or staff. That's a pretty big piece of information. How much information do you know on that, and how soon will it go into effect here in Ottawa?
The guidance or information that this is the direction to go in came out late last night, and so today we're working to get some more detailed information about the implementation plan. We certainly will be following the provincial guidance here in Ottawa and across the area. It will require partnership with our hospital and healthcare sector and the long-term care homes themselves. So this is something that we started discussing as soon as we saw it, and we'll keep advancing a plan so that it can be done in a coordinated way.
Okay, great. So I look forward to seeing some of those, and if I think it's good to keep council updated on that, especially with the hotspot ones. I'm thinking of Jan has a home in her area, and of course Laurier Manor. We've seen those numbers spike quite a bit. So anyway, I'll keep it at that, Mr. Mayor. We have a long meeting ahead, and just want to thank everybody today.
Great, thank you, Councillor Tierney. Councillor Gower, please.
Thank you very much. I do have one question for Dr. Etches, and it's a question that we received a number of times from residents, and I was hoping you can just clarify public health's approach on this. We have residents asking, how many specific cases are there in our community, in our ward? And I know up to now, Ottawa Public Health has been providing citywide numbers. Can you just clarify or explain for residents why you're taking this approach?
Sure. Yeah, and I can provide an update on where we're going as well. So the information that the public needed, early on and continuing, was that COVID-19 is in the community, and your risk of picking up COVID-19 is there across the whole community. And so, we needed to treat interaction with others wherever you were in Ottawa as a potential risk for transmission of COVID-19. The information we have about individual cases does include geography. It includes postal codes. It includes, gender and age and Indigenous status as well. We're looking at adding in information about ethnicity as we go forward with a new case management tool that is more automated and gets us away from a paper-based process. And so we have started to look at how we map those cases across the city, and we will do that and make that available going forward. The protection of privacy is always, and so when you have low numbers of cases, you don't want to publish something or a map that identifies, an individual potentially being positive. But this is the kind of information that, as we go forward and we want to try to be more targeted, geographical information is useful. We are looking at working with developers to implement a contact tracing system that's an app that people can have on their phones, and it's a consent-based approach where people have to voluntarily decide they want the app on their phone, and then if they test positive, they can voluntarily again give us the geographical information about where they've been in that period prior to becoming positive. So all of this information, becomes something that we can look at summarizing and putting out to the public, also to inform their activities. The basic message is still the same, that for anyone across Ottawa, wherever you are, if you have an interaction with someone else, it still could lead to transmission of COVID-19 if you're not staying 2 meters away, because we have asymptomatic cases. We have people who are pre-symptomatic. They don't realize they're infected yet. And so we still need to keep that in mind foremost.
Thank you very much. I have no further questions.
Okay, thank you, Councillor Gower. Councillor DeRose, please.
Thank you, Mr. Mayor. I want to thank, of course, echo all my colleagues, thanking our city staff and management, of course, and the leadership for you, Mr. Mayor. But I also want to thank Councillor Shantiri, and I do have a quick question for Dr. Achieve. Doctor, concerning the long-term residents, right now we're not doing testing unless we do have a case or we have an expected case or we have someone with symptoms. Why we're not testing everyone at the long-term homes? Specifically now we know, and what we've seen of the data that we've been getting, most hit are the long-term homes. In my area we have a long-term facility, and we're not able to test everyone, including staff and residents. Can you just a little bit give us some information why we're not doing all these testing, and we keep saying we need more testing?
Yes. So I think the testing strategy continues to evolve. As was mentioned, there's new guidance from the ministry last night, and we're looking for more details about their thoughts on how to implement that and roll it out. The challenge is always to think about any risk of an approach and what you'll do with the information, and what is most important to keep in place to protect residents and staff in long-term care homes and retirement homes. It's the physical work of putting up barriers with gloves and gowns and masks and the way people interact with each other and the processes they use to control the spread of infection that is most important. So the testing is one piece of the toolkit that we'll continue to use and we'll continue to roll out where it's needed, and what the province has indicated could be useful in a surveillance kind of role. But what we also want to do at the same time is make sure that these other practices which will protect people on an ongoing basis are in place, because any test at one point in time only gives you the picture right then. It doesn't necessarily capture everything or tell you what's happening, tomorrow or the next day. What we need to have in place are those infection prevention and control measures that protect people every day.
Thank you, Doctor. As long as I'm just trying to relay the messages what we're hearing from our long-term facilities and our executive director, the nurses, and RN. And I appreciate all the work you do. But if you keep advocating and keep us updated on what the message we're getting from the province, because we're really in the need to do more testing in those vulnerable areas, specifically in the long term. Thank you very much, Doctor.
Right, thank you. Thank you, Councillor DeRose. Conseiller Fleury, s'il vous plaît.
Merci, Monsieur le Maire. Et puis, moi aussi, j'aimerais ça.
I also want to reiterate what was said so far. Thank you to management for updating us.
They relate mainly to the financial side, and I wonder, Wendy alluded to the end of our presentation about looking for one-time grants or sources of funding. I wonder what is our coordinated approach for those asks? Is the mayor proceeding with that? Is that conducted through Wendy's shop or Steve's shop? Because I think a lot of those asks, like for example, we on a regular basis hear from commercial property taxes asking for what relief is available. We've heard recently about the housing ask, especially around hotels, and then obviously the tourism sector as a specific risk following the reopening of some of the services. So I wonder who's coordinating our ask and how that will be. How are we going to involve council?
Yeah, if I could just offer a comment on that, Councillor. Any asks for the city, the corporation of the City of Ottawa, for our shortfall has been coordinated through the Big City Mayor's Caucus and LUMCO at the provincial level. So we're now in the midst of discussions with the Deputy Prime Minister and other ministers at the federal level on a weekly call. And ultimately, we're going to put forward our best case in terms of funding, whether it be one-time or base funding for the shortfalls we're having to deal with as a result of COVID-19. With respect to other sectors like tourism and so on, we're advocating obviously for those areas, but it's primarily their associations that are taking the lead on that. And the federal government, as you know, almost every day has a different announcement to help another sector. So we hope that they take into account some of the areas, whether it be housing or tourism or other small business challenges that our companies and local businesses are facing. So at this point, we don't have obviously a firm commitment from the federal government with respect to funding cities, but they've been very open to suggestions that we brought forward on everything from gas tax to grants to base funding. So the minute we have something from the feds, then obviously I'll be pleased to bring it to council.
Okay, that's helpful. Thank you, Mr. Mayor. The additional piece to that is obviously we are all in regular conversations with our MPs and MPPs, and it came up in our conversation of what is the ask as it relates to purchasing of housing or hotels or whatever it is. So maybe we can take that offline, because I don't want us to individually have different asks and then confuse our senior levels of government in that regard.
Yeah, I think that's a good approach. I would encourage members of council that have ideas to funnel them through my office so that we don't send a mixed message asking one group of MPs or MPPs for a certain amount and then another group another amount. So I think if we can coordinate it, if you have those kinds of ideas. I know that Donna has had some discussions with respect to hotels and so on that she's looking into right now. But again, those are really dependent on us getting some funding from the other two orders of government.
Great. I'll continue to be brief, Mr. Mayor. Just on the isolation spaces, I want to applaud staff in their effort to working with the community partners on that front. I do want to identify a risk. So, as you know, many of the families are staying in local motels, and now some of them have been moved to other hotels and University of Ottawa residences. And now those families are reaching out to us and saying, well, I'm not going back to the other spaces. So I'm not expecting us to have an answer today, but I do want to flag that as a going forward issue, all tied into our previous motion on the housing emergency that we passed. So just flagging that. Maybe as a wrap-up question comment, want to thank staff on developing the seniors plan specifically for rural and vulnerable seniors, including Ottawa Community Housing. I'll be excited to share the general numbers of how many seniors were reached at OCH as that information becomes available. And maybe just as a wrap-up comment from Steve or Dan, as it relates to summer temporary employment. So a lot of the students, well, everyone's home, but they rely on some of the part-time summer student. We saw the financial outlook. We hear about the June 30th deadline. what's our expectation for those temporary part-time students over the summer? And what information can we relay to them now so that they can start making alternate decisions if that's the case?
Dan, you want to take this one?
Yeah, Mr. Mayor, it's Dan again. We are still in contact. Our summer recruitment process has gone ahead. We have set for ourselves to put confirmation of any hiring or of any program decisions until at least May the 1st. And I know that's going to come around quickly. But until we get a clear line of sight in terms of the level of programming that we're going to be offering and how we're going to phase that back in at some point, we're not making hiring commitments at this point, since we're simply not certain of the level of service that we're going to be providing in July and August at this point.
Okay. Anything else, Councillor?
Thank you, Mr. Mayor.
Merci. Councillor Hubley, please.
Thank you, Mr. Mayor. I don't have any questions at this time. What I wanted to ask has already been asked.
Thank you. Councillor Menard.
Thanks very much, Mayor. Most of my questions were answered at that Board of Health meeting on Monday, which was very helpful. I want to reiterate one around the open spaces in our parks, particularly for underserved communities and those living in apartment buildings and without access to yards. We continue to get requests from folks. And so I guess the question for the benefit of council is OPH asking the province to begin to lift the restrictions regarding the open spaces in parks as one of the first methods of harm reduction while still maintaining distancing requirements?
It's Vera here. Yes, I think these are the things that, as we have a formal engagement from the Ottawa community, that we want to feed back to the province as they're doing their work in terms of their priority setting and their plan for relaxing restrictions. That is the kind of thing that we would be sharing.
Okay, thanks very much, Matt.
Great, thank you. Councillor Dudas, please.
Wonderful, thank you very much. I'm gravely concerned about the impact that this is going to have on our city's budget, not just for this year, but, Mr. Kanalakos had indicated that we're going to see a significant ripple effect into next year's budget, and goodness knows for how long. I'm just wondering, I know it's very, very early, and we don't know exactly how long this will take and which scenario is going to play out in terms of the timelines, but I'm just wondering if, say, Wendy or Steve can speak to the fact of how do we think this might impact our city's ability to deliver core operations going forward in terms of the day-to-day? Will this potentially impact our ability for staffing levels? And are we looking at how our city staff and our delivery of operations are being delivered today, and if we can adjust it to make us more resilient to potential situations like this in the future?
Mr. Mayor, I'll start, and then Wendy can close off on the financial end. Thank you for the question, Councillor. One of the main focuses that we have right now is on our staff and the redeployment of staff. We have as part of our task team and our people task team, what they have looked at and done the analysis is how many employees are in the organization who are in a situation because they can't fulfill the job because of personal reasons, or the nature of their job is no longer being performed because we've closed that service and we're not delivering that service anymore. And we've identified about 530 people in the organization who are in that situation, and we basically have contacted or are in the process of contacting them all because we've identified the high priority areas in the organization that we need to redeploy staff to be able to sustain services, particularly in the social services area and in public health. And there's a number of other ones now that we're seeing some pressure. And so what we're doing is ensuring that we don't have staff that are home that aren't contributing and helping deliver service when we need it most. So we're monitoring that very carefully. We are also, this will happen after, but in terms of post operations review, we will be looking at, and I was on a conference call yesterday with a bunch of business leaders. Everyone seems to be, the mindset is really converging. Everyone is looking at how should your organization be structured post this event to be able to be more resilient as you go forward. And that's something we're going to have to look at in the future in terms of nimbleness and where do we have to have our people. But for now, our immediate focus is we have pressures in certain areas of the city. And we need all our people to be able to contribute to that. So contrary to what we initially thought, that where there'd be, thousands of people not doing anything, most of our city services, or all of our city services, other than maybe 1%, couple percent, are actively still engaged. They're just delivering the services very differently. And so we've been focusing on where we need to deploy to help service areas that are struggling, and that's what our focus is on over the next 2 weeks until the first week of May. So, Wendy, do you want to talk about the financial look?
Sure. Thanks, Steve. I think there's two important pieces here. So first is the fact that it's still very early on. We're really trying to get a grasp and understanding in terms of what it looks like now for us, and then forecast that piece into the future. So much to your point, Councillor, I agree. We need to understand what the impact is going to be, or what that ripple effect is going to be into 2021. And that's some of the work that we're going to be doing over the next couple of months in terms of, I'm going to say, some usual assumptions that we make in developing our budget. And do we need to tweak those, and what impact that will have? Because then we're going to have to make some adjustments. So when Steve spoke about the financial task force, that is part and parcel of the work that's going to be done through that. And we will be reporting back to Council in terms of what that landscape looks like. I just think the second piece to this that's really important, and what we've seen throughout this pandemic response and how the city has reacted, is how we've actually functioned and changed the way that we've delivered our services. As Steve said, we're delivering almost, I want to say 98% of what we need to, but we're doing it very differently. And I think that there's some big opportunities that we have here to be able to deliver those services in a different way. And so we'll be looking at that as well in terms of our overall view as we move forward into the future.
Thank you so much for that, and I appreciate the updates. I also appreciate all the work that city staff and Ottawa Public Health and our essential services and our frontline workers are providing. So thank you very much. That's it for me.
Great. Thank you, Councillor Dudas. Councillor Meehan, please. Councillor Meehan, the mute button.
Can you hear me now? Okay.
Yeah, now we can.
Thank you very much, and thank you to everybody for their great updates. I think that Steve actually answered one of my questions, and that is with the possible redeployment of some of our workforce. Steve, if I could direct my question to you, have you figured out, or do we know exactly what percentage of our workforce might be, and for lack of a better term, I'll call underutilized? I'm thinking specifically if you work with the union to identify who might be redeployed. I was thinking that we could maybe put individuals at some of the city parks that would wear a red vest, much like they did an LRT, to just reinforce some of the distancing rules. Maybe if we did this and they passed out information at the park entrances, we could avoid some of the fines or some of the confrontations or some of the little skirmishes that have been happening in our city parks. But that's just what I'm thinking. If we could do something like that, I think it would be a great idea if the unions and the staff were amenable to that. Has that been considered at all?
Mr. Mayor, thank you, Councillor. No, we hadn't actually thought of that. as I said, we have about 532 or 530 people that we've identified that are underutilized right now, and for various reasons. But you know what? If you allow me, I'd like to take that back to our emergency operations group and sort of do an assessment of, you know, what kind of call volume and problems are we having in the park still, and whether there's some benefit to doing some more proactive measures rather than having people, you know, inadvertently walk into a situation and then get into trouble. So I'd like to take that back to the team and consider that in terms of our redeployment strategy, if you don't mind, Councillor.
That would be great, because I think that you know, the human aspect of it, people just, I think it would be a safe job just to try to explain to people, yeah, don't work, you know, if you're a family, but keep distancing away from other people. These are the rules and regulations, and we can avoid problems. But, you know, a team like that, they did a wonderful job on the LRT, and I think we could really use them in this situation. So, yes, I would love if you took that back. One other quick question. I don't know if this goes to Wendy. Wendy, in terms of lost revenue and cost, and have we figured in, are we paying Rideau Transit Group our $5 million a month right now? Are we continuing to do that, given that the trains are not full? We haven't had any problems, so are we continuing to issue that payment?
Steve, do you want me to take that, or do you want to answer that?
Well, John, are you on the line?
Yes, I am, Steve.
Could you please take that, because we've been engaged in that topic?
Thank you.
Yes. So, as Council knows, the only maintenance payment we made is the one that we have advised you of. There's been no other maintenance payments to date. What we are working on right now is looking at the April payment, which there's requirements if they do achieve the service with the reduced fleets count, they'll be entitled to a payment on that, and we've made it very clear to RTG we just pay them for what they're entitled to. There is active discussions ongoing right now with RTG about the holdback. As you know, we've held back millions and millions of dollars of payments, and we still are waiting their invoices for January, which, as you know, was a very difficult month, and February. We have received their December invoice, which I know it's a distant memory right now, but they did have a fairly decent December, so they might be entitled, and I emphasize might, be entitled to some payments on that. And what we're doing, Mr. Mayor, is we're going to reconcile all that information, and if we are going to proceed to any payment to RTG, as we said last time, we will advise Council.
Thank you for that, Mr. Mazzoni.
Thank you.
You said there's no maintenance payments? Is there any other payment that they have been they have received?
No, we are working our way through the disputes that you were briefed through in camera. And again, if we do give any payments, we'll advise you on the maintenance directly via memo. And then there's also the quarterly updates, which I know we're working on one that should be out shortly. If there's any payments on the capital side of things, we'll do that. But again, we're working through them literally line by line on the disputes and the updates that we gave you in camera.
Okay. I appreciate that. That's all my questions. Thank you.
All right, thank you. Councillor Luloff, please.
Merci, Monsieur le Maire. Je veux simplement remercier.
Well, thank you. I'd just like to thank the citizens of Ottawa and Orleans for following Ottawa public health directives.
Library for the hard work bringing programming like baby time and bilingual children's story time into our homes online. I understand firsthand how difficult it is to break up your day and to keep things interesting for our young children, so thank you very much for that. À Monsieur Chenier, quel type de programmation en ligne?
Mr. Chenier, would it be possible to provide online recreational services for parks, for example?
Aquatic leadership courses to help ensure that we're prepared for after the pandemic. It seems to me that this might be a way to curb some of the budget shortfalls that we're experiencing with innovative ways to bring this kind of programming online.
Mr. Mayor, we are looking at some online possibilities, both in terms of children's activities, and we have something that should be rolling out fairly shortly where folks can interact with Dexter, our mascot. There are online Friday coloring events with different templates of Dexter doing things relating to safe distancing and washing hands and those kinds of things. We're also exploring for, as we move into summer, if we're not going to roll out complete on-site programming, whether we can expand into more online in the area of fitness, in the area of certification that you mentioned. Those are all possibilities and things that our programming and our communication staff are working together on, and we're hopeful that we'll be able to start to roll them out, as I said, probably within the next 10 days to 2 weeks in terms of summer offerings as we get clearer on how much of the things we're going to be doing are live and how much will be virtual.
That's awesome that you're already working on that, Dan. Thank you for that. I think that some revenue generation might be able to occur if we're able to run some of those dry portions of aquatic leadership courses and first aid. So I'm really glad that you guys are looking at that. And so thanks to all the GMs and your staff for your hard work. I have no further questions at this time, Mr. Mayor.
Merci, Conseiller Lulov. Councillor Kavanagh, please.
Well, thank you very much, Mayor. And thanks to everyone for their presentations. I'll do quick thank yous. Thank you to Councillor El-Shantiri for being ready in case there was a flood, and we're very grateful there isn't. I'm watching the waves out my window here as they splash, and I'm glad that they're rather low. So we've dodged that. Very much appreciate all the work of everyone. Thanks to Dr. Etches, we had a very productive board meeting on Monday night, and lots of good motions that went through. And I want to thank her for her leadership on many of those initiatives, particularly on the community garden, and all of them. They're all very good in terms of keeping a balance between what needs to be done with physical distancing and with mental health, and just in terms of overall progress. So thank you very much, Dr. Etches. I would like to talk about the finances. It's something that we're all worried about in terms of how do we get through this, and we're looking very closely at the federal government. And I appreciate that we'll have a representative talking, yourself, Mr. Mayor. And was it Mr. Willis is going to be also taking the initiative on that?
Sorry, on which initiative?
On working in terms of the federal government and working with other municipalities.
Yeah, it's more Wendy as the CFO. They have their own table. The CFOs meet on a regular basis, so it would fall more under the treasurer as opposed to Mr. Willis. But he's feeding, obviously, information, as all GMs are, as to what the shortfalls are to Wendy.
Okay. I'd like to just ask a couple of questions, and I think I know the answer, but I'm just going to ask them anyway because this is what I get from residents, and that's fear of that these shortfalls will land on their shoulders. One of them is because there's been the ticketing going on in parks, and they're very high prices. They're viewed as revenue grabs. And I know there haven't been a lot of tickets, but I just want to ask about what kind of revenue have they brought in, and is that considered a revenue source? This is in terms of the parks. We're hearing people getting tickets for walking their dog in a park, etc.
Yeah, is Tony DeMonte there? I'm assuming it's about 50 tickets times 700, which is what, $35,000? I don't think it's a lot of money in the scope of things. Tony?
That's correct, Mr. Mayor. It's less than 3% of the thousands of interventions we've done, and the fines are set by the province. It's under the provincial order, and that includes in those, Mayor, those of businesses that have remained open, so not just in the parks. So it isn't very much money. You're correct.
Yes, thank you. I just wanted to have that said publicly because there is that concern when they hear about the fines that we're trying to make up revenue, and I think that's very important. And overall, I think people worried that their property taxes are going to go up, et cetera, because they see these reports, and obviously things are different right now. One of the suggestions I have is talking about permanent solutions and formulas for municipalities. Currently, we have a heavy reliance on property tax, and perhaps this is an opportunity to work out something more permanently with the federal government, where we have a more fair taxation system, where they work with us in terms of the of income tax, and that municipalities get a proportion, rather than this reliance on property taxes, which we all know is not as fair. Is that going to be considered? Or can it be considered?
Yeah, I think as the Prime Minister and the Premier have said, everything's on the table. That table's getting bigger every day, I think, when people say that. Obviously, I think we at the municipal order of government recognize the fact that we're being asked to do a disproportionately amount of heavy lifting without the tax base to cover it. We haven't gone into a lot of detail about anything to do with, for instance, shares of income tax and so on. We've really been trying to stick to things that we have in place already, such as the gas tax, and whether there's a desire and a willingness to move that ahead, as they did last year, where they doubled the gas tax for the 1 year. That helped us a lot. So, we're open, and I'm open to bringing other ideas. I think the problem is that, as you can imagine, both those other orders of government, like we are swamped with so many other issues they have to deal with on an immediate sense, that we really haven't had the opportunity to look longer term at the fiscal arrangement or imbalance between municipalities and the province and the federal government. So I think everyone is struggling to get through each day to minimize the deaths and people who are having to deal with this horrible virus. But I'll certainly take that as a point to bring forward at future meetings.
I appreciate it. Recognizing, yes, we are going through tough times, and there's a lot of asks, but this is an opportunity to look for permanent solutions that will be more fair to taxpayers overall. So I hope that we'll push that agenda, and I appreciate that you acknowledging that. The only other question I had is in terms of things happening in our wards. It's already been asked about. For example, when we have long-term facilities in our wards, if we could get information by ward of things that are particularly happening, for example, a long-term facility, a long-term care facility, is that possible that we can get heads up on information that's going on in our area?
Dr. Etches, is that possible?
Yes, Councillor, that is underway. So an update went out to all councillors last night, I believe, to explain that we appreciate you need that information to be able to respond to questions from family members and constituents. And so this is something that we will make sure we're providing into the future.
Okay, thank you very much, and I appreciate all the work that's already going on. You've been doing a great job in terms of your team responding to my staff. One more thank you I want to give is to councillor staff, because I know mine are working extremely hard from home. People don't realize that even though they're at home, they're working very long hours, and I believe that most of the councillor staff are. So I just wanted to give them a shout out as well. And as you know, I've got a motion. I also want to mention about my motion that I'm going to ask for, if we can suspend the rules to extend the community shout out so we can continue to thank our essential workers.
Okay, we'll deal with that. Thank you very much,
All right,
Councillor.
thank you very much.
Councillor Moffat, please.
Thank you very much, Mr. Mayor. I have no comments or questions at this time. Thank you.
Great, thank you. Councillor Sons?
Thank you, Mr. Mayor. Likewise, lots of great questions asked. are already answering my questions, so no further questions. Thank you.
Right, thank you. Councillor McKenney, please.
Thank you, Mr. Mayor. I just had one comment, just picking up on some of the previous comments about the need for green space, and I just want to add, if I can, Dr. Etches, to what you're hearing and what I'm hearing from residents for their need for green space. They are looking at, our approaches to relaxing those restrictions. Of course, I'm always very mindful that I take your direction as the medical expert, and I think most people, understand that and can appreciate that. But just want to also pass along, the fact that many people don't have a backyard, and as we continue in isolation, our self-isolation, and our physical distancing, that people are starting to wonder about those how we're relaxing the restrictions, any mitigation practices, more of a harm reduction approach. So I just want to add that into today's discussion. I do have one question, and it is to Dr. Etches on shelter residents. I know there's research that's just come out of Boston that I don't think would be any different at any shelter, that showed 36% of people in shelter had the COVID virus, and that most were asymptomatic. So it's similar to what's happening in our long-term care homes. We could see easily quite an explosion of cases in our shelters, and I just wondered if any of the new guidance from the ministry is looking at, again, testing everyone in shelter to ensure that people, who are asymptomatic, who aren't showing signs, are being isolated out of the group.
Thank you for your question, Councillor. I agree with your assessment that shelters are similar in some ways to long-term care homes, where it's difficult for people to be self-isolating, and where there's a higher risk of transmission of COVID-19. And so it is a priority to be able to provide alternatives for people and to look at measures to control infection transmission. The ministry guidance that came out last night was fairly specific to long-term care homes, but it did contain language about scaling up this kind of response to retirement homes, and we have heard, previously the ministry talking about congregate care settings more broadly, so including shelters or group homes or hospices. So from an Ottawa public health point of view, we are taking a similar view of the risk and considering what is needed. We do need to have a coordinated approach to testing across the region. The volume of testing needs to be carefully managed so that we are able to process the priority tests of people who really need that result for a clinical management, I think I understand why the province spoke about long-term care homes first, because that is where we are seeing, unfortunately, death, and we will continue to understand that guidance and think about the way forward, as well as making sure the most important practices to decrease transmission are in place, regardless of a one point in time testing approach. We just need to have that ongoing protection for communities.
Okay, so just so I understand then that that it is on your radar, it is something that Obviously what's happening in long-term care homes today is immediate, but just to ensure that it's on our radar, that we understand that we could see the same thing happen in our shelter. So I thank you for that, and that's the only question I have. Thank you.
Great, thank you very much, Councillor. Councillor Brockington, please.
Thank you, Your Worship, and good afternoon to you and everyone. I guess I'll start with a question of the city manager. 2 weeks ago at our last council meeting, I asked a question about once the state of emergency is lifted by the province of Ontario, how locally we will make decisions to start to reopen our city across the city. And today I heard Dr. Etches briefly touch upon criteria that she wants to be reviewing before decisions are made, the decrease in hospitalizations, that the healthcare system has, an expanded ability to test, that we're able to basically infiltrate hotspots throughout the city and provide them with support so there's no spread. Just touched upon schools and workplaces, but at the end of the day, I'm trying to understand who's in charge, who makes the final decision locally in Ottawa about how we start to reopen, and are there other criteria being used to factor into that equation? Because for me, that's still a bit murky, and I just wanted to have clarification today.
Mr. Mayor, I'll start, and Dr. Etches can add her comments. The direction that ultimately we're going to get is from the province. I think as they start announcing changes to their emergency order and relaxation of social distances, their definition of what essential services are and what they believe can open, in terms of priority. And the Premier has been, speaking a little bit about that in advance, and we know that they're planning that, and we know from I've been on conversations with senior federal public servants at the deputy minister level where they're looking at that too. And what they're very interested in is what's happening locally, so they can feed that into their decision-making process and how they're going to communicate that. And of course, locally, Dr. Etches is going to be advising our team in terms of how we support businesses from a service perspective, but then she has a role as medical officer of health in terms of what local advice she's going to be giving businesses and city services in terms of how we open. And that's why we set up those task forces. Once we understand, we're starting to think about it in anticipation of what the announcements may be from the provincial government. And that's why we have public health engaged in our recovery task team, which is led by Mr. Willis, and Dr. Etches and her team will be participating in that. And of course, Dr. Etches is on the Emergency Operations Control Group and is our key advisor in terms of the decisions we make and the actions we take on a daily basis. So, Dr. Etches, do you want to add anything to that?
Just appreciate that we do have excellent relationships across different sectors involved. The way we work is collaborative, and we'll be working to make decisions together. The other sector that's involved clearly is the healthcare sector. So working with leaders in the healthcare community, because that's one of the key variables is how they're doing, what their capacity is, and they also run the testing. So just to confirm, the main parameters will be set by the province, and we'll work on implementing what makes sense in Ottawa. And I will have Ottawa first and foremost in terms of protecting lives here in mind. That is the responsibility that I have. And so we'll use local evidence and local data also to inform, the response.
When this first started about 5 weeks ago, the immediate concerns about preparation were, do we have enough PPE? Do we have enough hospital capacity? Do we have enough ICU capacity? And when talks then evolved to when we're going to open up, we wanted to make sure those initial concerns were dealt with so that if there was a second wave, we would be prepared and ready. And so as part of the discussions, we want to ensure that any type of reopening lessens risk as much as possible, that we have good strategies in place. So I'm just evolving to my next question, that is, when businesses start to reopen, in whole or in part, small businesses, medium or large, and if school is still out, if we don't do this complementing one another, meaning reopen schools and businesses at the same time, how will families and parents who have parents that go back to work have care for their children? And maybe the plan ultimately is to reopen both at the same time. Maybe June 1st schools will reopen. I don't know. But as much as I want to see businesses open, and trust me, I do, the other main part is, well, what do we do with children who aren't in school? So I assume that's being looked at.
Mr. Mayor, it's Steve Willis. If I could answer that question. The Economic Recovery Task Force absolutely has that specific item on our task list to try to reach out to the province to get more direction. As the city manager said, those decisions rest with the province, and we share the councillors' concerns, and it is one of those factors that we do need to figure out as we try to get the economy up and humming again.
Okay, thank you. And just going back to Dr. Etches, I heard you state more than once that you would have liked to have had an additional 1,000 people join OPH temporarily, at least, to help with trace testing and to do that very specific testing so that once we start to reopen, we can mitigate new cases and stop the spread right away. Has there been any progress? Do you still need that number of staff? Have you added new staff? Are you as prepared as you can be so that when we reopen, you have what you need?
Thank you for the question. The City of Ottawa has definitely helped us with redeploying staff to Ottawa Public Health. 75% of all our staff are involved directly in the COVID response. And of all the people working on the COVID response under Ottawa Public Health, 30% are from the city, and that's about 140 people right now. The projections to require 1,000 case managers have been modified because the increase in the number of cases has slowed down, and so we aren't projecting the same demand, and so we are modifying that down, and it will depend on the provincial testing strategy. If we're able to test more, that's more results than we need to follow up on. So our estimates of what we need into the future are less reliable the further out we go. But right now we are coping, we are managing, we have added to the team, and they are doing the training and adding the supervisors and supports so that nurses who have joined us from the Registered Nurses Association of Ontario, over 100 students who have joined us, that they're all, becoming case managers and experts in this public health work. That is underway.
Thank you, Doctor. And just finally, going back to the finance side, if the largest revenue shortfall right now is from the loss or lack of revenues from public transit, why are we not taking more stronger efforts to reduce costs at OC Transpo to help offset that lost revenue?
May I ask John, because we've been looking at that, John, to comment on what the findings have been on that?
So, Mr. Mayor, what we're doing right now is we have staff resources set up to maintain the services that we've got right now, and the service, even at the reduced level, is critical and is being used by all those essential workers that are supporting the community with proper spacing. So we do have that social distancing that's required. And that is the other element of our strategy, is also that we do have, as you know, people that have either been infected by COVID, are in isolation or self-isolation, and normal sick leave and so forth. So the rosters that we have right now are sustaining the service. So while, yes, there are operators, for example, that are on alternate shifts, it's to preserve the capacity of the system and make sure that we can sustain it through the difficult period that we're going through right now. On the fleet and facility side of things, there is more work than we even have resources for, so much so that we've brought in contracted services. We have enhanced cleaning that's required. We have maintenance inspections that have to be kept up to date and so forth. So there's, the mechanic staff, fleet staff, they've stepped up and are literally working all their shifts, and all we've managed to do is do staggered shifts there. In terms of looking forward, I know you've heard TransLink and other agencies in Canada are doing massive layoffs in that area. Vancouver specifically has announced massive operator layoffs. That comes with corresponding reduction in service, drastic reductions in services. The fact of the matter on that is that they have a different funding source there, but also the cost to lay off and maintain the provisions of collective bargaining rights, recall and so forth. As you found out during a very bad strike many years ago, 11 years ago now, everybody thinks you save money, but ramping down and then re-ramping up, recertifying everybody, making sure your inspections are up to date and retraining everyone, the costs outweigh the benefits, particularly with all of the variables that we have right now, where we don't know what return to normal date is. We are planning, as the city manager has talked about, in terms of potential dates, we putting all those variables into play. So it's a very complicated scenario. I know on the surface it seems like we could save millions of dollars. We are, as Wendy, the treasurer, pointed out, on where we can, reduced overtime and those things, and cutting off certain things that we can do. But it's about preserving the social distancing, providing the critical services that we have right now. And as some of the councillors know, we've had to add trips, and we also supplement the rail operations. We're sustaining that with operators and so forth. So, Mr. Mayor, I don't know if that answers all the elements of that question.
I appreciate the reply, Mr. Manconi, and thanks, staff, for the presentation today and everything else that's going on. So thank you.
Right. Thank you. Thanks, Councillor. Councillor Leeper, please.
Thank you, Mayor. I have a few questions for Ms. Stevenson with respect to the tax deferrals. Her presentation noted the drag on finances arising from those, $500,000 if it goes till June, 2.1, 2.7 in December. What does that represent? Are we assuming that some of those tax deferrals come in?
So that's basically the lost investment income that we will not see or not have in terms of the deferrals that we're approving. So as it stands, typically when the money comes in, the city will invest that until it's required. So what you're seeing reported in the slide deck is basically the pieces that we can't invest, so it's lost interest income to the city, and also some lost user fees associated with the services that we provide.
Okay. So, what is the overall amount of taxes that have been deferred to date?
So, as of the beginning of this week, we were almost close to 700 approved applications and approximately $6.6 million in taxes. As you know, the applications are open until the end of July. We expect to see more that will come in through our final billing period, and we'll certainly report out on that.
Okay. And do you have any insight as to the breakdown between commercial and residential on those deferred taxes?
I do have the breakdown, Councillor, and if you don't mind, I don't have the numbers in front of me right now, but I can circle back and share that with you.
Okay. The commercial taxes, as we've spoken a few times about, are of particular interest to me. There are still landlords who are playing hardball with their commercial tenants, which I don't think serves anyone's best interest, but there it is. One of the things the council on that front was very deliberate about doing was to require that commercial tax deferrals flow through to the tenants. Do we have any indication at this early stage as to whether or not that is actually happening? Are you fielding any phone calls from the tenants in your office?
No, I have not heard of any.
Okay. And it's probably too soon to tell. And then finally, with respect to property values, I know I asked maybe a couple ago, but long term, this pandemic may or may not have an effect on assessment values for both commercial and residential. I'm hearing about a continued hot residential housing market in Westboro, which is encouraging in terms of being able to sustain residential property taxes. But do we have an idea of, at this point, what are the analysts saying about commercial property values and whether or not that's something we need to take into consideration as we look out for a couple of years of forecasts?
It's a good question, Councillor. It's something that we really don't have an eye to in terms of what that future forecast is going to look like. What we know today is that the assessment, so our 4-year cycle assessment, was pushed an additional year. So that means that any residential or non-res property will have the same value in 2021 as it did in 2020. The only piece I think that's interesting here is the fact that the assessment values for the next cycle will be based on January 1st, 2019, unless there's changes to that. But that is the date that was chosen by the province. So it's really a question in terms of how the province looks at this going forward and if they make any changes to that.
Okay, it's something we'll need to keep an eye on, and certainly if you're talking, and Mayor, if you're chatting with commercial property owners, I have been grateful to hear from a lot of them that they're working with their tenants. We don't see a main that is a lot of vacant stores in September, but I do think we need to reiterate with those landlords that it serves everyone's best interest to work with the tenants and make sure the doors reopen in September. Mayor, that's what I had. Thank you.
Yeah, that's a very good point, and I think that's why we're working with the Treasurer's office to ensure that if a big landlord is going to get a break by deferring their taxes, then that should be trickled down to the local shopkeeper as well. So I appreciate that, Councillor. Councillor Harder, please.
Thank you, Mr. Mayor. And I just wanted to say that all the kudos that I've heard before from other colleagues to our staff are well-deserved, but and lots of good questions asked. So rather than ask a question, I would just like to put a shout-out to all of the residents and businesses in our city who are doing a fabulous job, doing their very best to play by today's new rules, hoping for, the day when we can start easing some of the restrictions. I haven't really left Barrhaven. I haven't had the need to, and I haven't made it up an excuse to. But I can see how very hard people in our city are trying their best. And I just want to say thank you very much. Keep up the good work, and hopefully we'll start to see some restrictions ease up in the near future. Thank you, Mr. Mayor.
Great. Thank you, Councillor Harder. Councillor King, please.
Thank you, Mr. Mayor, and I'd like to echo the same sentiments of Councillor Harder. Many of my questions have been actually addressed by the rest of my colleagues, so I really appreciate that. And I do want to, as well, really acknowledge the hard work of city staff across the board, especially around the Human Needs Task Force. There's been a lot of response to a lot of inquiries from my office surrounding especially food security, and we'll continue to work on that since my ward has some of the highest usage of food banks in the province even before this crisis had emerged, and now we're seeing those rates increase by 25 to 30%. So we're really gratified by the response of the Human Needs Task Force, and we're also gratified by the work of the Economic Task Force, because we're seeing a lot of challenges with small business, and we'll want to work with small businesses to ensure their viability in the future after this crisis subsides. So thank you, Mr. Mayor.
Great. Thank you, Councillor King. And last but not least, from beautiful Alta Vista, Councillor Cloutier.
Thank you very much, Mr. Mayor. Merci énormément. I have no questions. All my questions have been asked, and I thank Dr. Etches for her continued leadership, and Steve Kanellakis and all the general managers for the presentation and for the information we got. I also want to take this opportunity to, on Monday we had an Ottawa Board of Health meeting. I want to thank the citizen board members who serve on the Board of Health for their work during this and during the meeting on Monday. Mr. Mayor, that's all from me. Thank you.
Great. Thank you, Councillor Cloutier. Okay, so reports rising directly to Council. Rapport présenté directement au Conseil. Ward 19 Cumberland vacancy options. Councillor Luloff and DeRuse have a motion. If you would like to introduce the motion, Councillor Luloff, and then we'll open it up for questions. I don't believe there's a presentation. It's pretty straightforward. It's giving us a little bit more runway to determine what's going to happen with, obviously, the COVID situation. And the clerk, I believe, is on the line if people do have questions. So we'll go down the list of everyone, but we'll start off by asking Councillor Luloff to put the motion on the table, please.
Thank you very much. Obviously, this isn't an ideal situation for a by-election. I've gone through the report and consulted with the city clerk to bring forward this motion, as in my opinion, the first option to defer the decision to fill the vacancy is the optimal way forward, which allows council to retain its decision power as it relates to filling the vacancy by either appointing or by way of a by-election until such time as OPH and staff are in a better position to assess the safe way forward. This option allows, at this time, for the greatest amount of flexibility and minimizes risks, given the ongoing nature of the COVID-19 emergency in our community. Myself, Councillor DeRuse, and Councillor Dudas will continue to support and cover off duties in Ward 19 to ensure that constituency matters are addressed and residents have a voice at council. Of note, Ward 19's office still remains open for Ward 19 residents with service requests and that sort of thing. Further, staff have agreed to bring back a report for council consideration no later than 30 days after the lifting of the provincial declaration of emergency. I believe everybody has received this motion, therefore I will just read the therefore be it resolved. Par conséquent, il est résolu que le conseil municipal rapporte la décision concernant.
Be it resolved that City Council defer the decision on how to fill the vacancy in Ward 19, meaning whether to appoint or enact a by-election bylaw under Section 263 of the Municipal Act 2001, until such time as there is further information available on when the end of the emergency might be expected, and that a report be brought to Council on this matter no later than 30 days after the provincial emergency declaration order is lifted.
Merci, Conseiller.
Thank you, Councillor. And that's seconded by Councillor DeRuse.
Just to see if anyone has any questions. Councillor El-Shantiri.
Thank you, Mr. Mayor. No question at this time. Thank you.
Okay. Councillor Eglai.
I have one quick question for the clerk, if he's on the line, Mr. Mayor.
He is, yes.
So, Mr. O'Connor, assuming things do not go as well as we all hope they go, and there's a delay in the lifting of restrictions at the provincial level, and keeping in mind that we have to fill this position at some point so the good people of the ward can have representation, how much time would you need in those circumstances to set up an appointment type process similar, for example, to what they've done at the school board in previous years when there's been openings and they haven't gone to a full election?
Mr. Mayor, it's Rick O'Connor. We'd probably be looking at the 30-day to 45-day period.
To set it up and hold it in totality?
30 days, to set it up. So 30 to 45 days to set it up and then implement it.
Okay, thank you for that. Appreciate it.
Okay, thank you, Councillor Aguilar. Councillor Tierney.
Great. Thank you, Mr. Mayor. Real brief, quick question. Mr. O'Connor, typically an election cycle is 75 days, I believe, if that's correct. Is there any opportunity to ask or request from the province a shorter election cycle, just to make sure we can actually have an election?
Mr. Mayor, no, I don't think there's that opportunity. I think the province has been, with their emergency orders, clear that we can action these matters ourselves as we need to. And we also have, as some members will remember from the report, we have certain emergency powers in the Municipal Elections Act as well.
Great. No further questions. Thank you.
Great. Thank you, Councillor. Councillor Gower, please.
I have no questions on this item. Thank you.
Okay. Councillor DeRuse.
No question, Mr. Mayor.
Okay. Councillor Fleury.
Yes, Mr. Mayor.
Councillor Hubley.
No questions on this, Mr. Mayor.
Okay, Councillor Menard.
No, good motion. Thanks.
Councillor Dudas.
No, I support this. Thank you.
Councillor Meehan.
Thank you, Mr. Mayor. Just one quick question. Can someone remind me of the population of Cumberland?
Sorry, what was that? The population of Cumberland Ward?
Yes.
I can tell you, Mr. Mayor, off the top that we have about 33,500 voters. We'll have a quick look at the total amount shortly.
Okay, that's all. Thank you.
Okay, thank you. Councillor Luloff. Councillor Kavanaugh.
Yes, I support.
Councillor Kavanaugh.
Yes, thank you. No further questions.
Okay.
Thank you.
Councillor Moffat. Councillor Moffat.
All good.
Okay. Councillor Suggs.
No questions, thank you.
Councillor McKinney.
No questions, thank you.
Councillor Brockington.
No question, just a comment. One, I support this. I do think it's wise to have a deferral until we have a better idea of what we can or cannot do safely. My only comment, would be that it's my strong support for a by-election. If it's safe to do so, I think that's the route we should be headed. Thank you.
Okay. Councillor Leeper.
No, I'll be supporting this. Thanks, Mayor.
Councillor Harder.
I'm fine with this, please.
Councillor King.
No questions, Mr. Mayor.
Merci. Conseiller Cloutier.
Merci, Monsieur le Maire. Aucune question.
D'accord. So we have a motion before us, moved by Councillor Luloff, seconded by Councillor DeRuse. Carried?
Carried.
Okay. Any dissents? Any dissents? No? Okay. Next, Planning Committee rapport numéro 22 du Comité de l'urbanisme, modification au règlement de zonage 287 rue Lisgar, 287 Lisgar. On the report.
Mr. Mayor, if I could make a comment.
Yeah, Councillor McKinney, go ahead. Ward Councillor.
Thank you. Yes, thank you. I spoke to this also at Planning Committee, so I won't be long, but just want to register that I'm not in favor of the zoning bylaw amendment. It may seem like it's not a lot of extra public parking in the downtown with 28 new parking spots. However, this was not included in the original site plan, and the same applicant was granted a very similar zoning bylaw amendment over just a couple blocks over on Gloucester and Nepean for a 253 space garage. So At this time, it's unfortunate as a city we don't look at the aggregate effect of parking. We only do it one-off. But the more public parking we continue to add into the downtown, the more it undermines our transportation master plan and our ability to, shift our modal share to active and healthy transportation, including transit. So I want to register that and would ask my colleagues to turn down this application. Thank you.
Okay, and Councillor Harder is the chair of the committee. Comment?
Well, Mr. Mayor, I just wanted to say that Councillor McKenney raised the issue of them getting an exception a couple of blocks over, and one of the staff at the meeting said that was not the case. Whether it is or not, staff are supporting this, and the committee, with one exception, I believe, planning committee voted for this addition of adding the parking as a permitted use.
Sorry, Mr. Mayor, if I may, staff didn't indicate that it wasn't the case. What they indicated was they don't look at the aggregate effect, so they don't consider what's happening a block over. So I just want to make sure that that's made clear. And if we want to ask staff for their opinion on that, that's fine with me too. Thank you.
Okay, so we have a recommendation from Planning Committee before us. Carried. A dissent by Councillor McKenney.
Dissent by Councillor King. Dissent as well.
King. Leaper.
Menard. Slurry.
Menard.
Dissent.
Okay. Thank you.
Councillor Kavanaugh.
Yeah. Numéro 5, changement de modification de plan.
Modification to official plan amendment number 136 regarding minimum building heights in Canada Town Centre.
Amendment number 136 regarding minimum building heights in Canada Town Centre. Carried? Does anyone have any dissents on item 5? Okay. Next is numéro 6, modification du règlement de zonage 20.
Zoning bylaw amendment 25 Grant Street.
25 Grant Street. Carried.
Comment, Mr. Mayor.
Councillor Leaper, go ahead. You're the ward councillor.
I am asking colleagues to reject the staff recommendation on this one. There is a process right now, which we're just calling the R4 study, that is taking a look at the zoning in the R4 areas and recommending significant increases in density. One of the assurances that we've had from staff as a community that those is that the increases in density aren't going to result in increases in the size of the built form. Staff have been clear that they want to hold the line on how large the buildings get and have been relatively specific in the recommendations that they've made to date that we want to increase the density without changing the performance standards in a really significant way. The 25 Grant Street application is in one of the junior R4 areas in the city. It is right now capped at 4 units. The application is to make it 8 units. The Hintonburg Community Association and myself are not objecting to the increase in density. We recognize that the R4 study is going to lead to the kind of increase in density that is being sought in this application. But what I think we are very concerned about is that as one of the very first applications moving through in the new R4 reality of increased unit counts is that the building performance standards are not being adhered to. On principle, I think it's really important if you want to get the support of urban councillors for the increase in and for the urban communities for increased density, we have to know that the performance standards for the built form are not going to be a new floor from which greater building heights, building footprints are going to start. It's not a negotiating spot. So as one of the very first applications that's moving through the system in this new increased density R4, I am objecting to this, and I'm going to ask my colleagues to object to this on the basis that we are already fiddling with the performance standards when a hard line on performance standards is obligations that is being held out by the city to temper the effects of the greater density. Thank you, Chair.
Great. Thank you. Councillor Harder, as chair of the committee that brought forward the recommendation.
Well, I'm aware of Councillor Leeper's position, and I would suggest that if Mr. James or Mr. Willis are on the phone, that they could respond to this. This is minor, very minor. One of the issues that was raised was really will be dealt with at site plan on the driveway, and the exterior stairs. The difference in the permission is less than a meter, and committee supported this 8-unit 3-story infill project.
Mr. Willis, Mr. James, do you have any comment?
Mr. Mayor, it's Steve. I'll start and then I'll turn over to Doug. Just go back to Councillor Leeper's comments. While I understand the concerns, this application does predate the new rules. It is not, the new rules are not yet in effect, and so under the Planning Act, we are legally obligated to consider the application with the policies that are in effect today and really assess whether the impacts being requested are minor in nature. And that's, we have to work with the rule book that exists today, and staff's recommendation was based on the fact that the changes are consistent with the direction we're going and minor in nature. However, I understand the comment that Councillor Leeper has raised about the R4 study separate from this file. I have committed to Councillor Leeper that I will discuss with staff official plan policies to deal with that very specific concern about floor versus ceiling in the official plan, either the draft official plan or perhaps even before that when we bring R4 forward. But I have to separate out this application from that future report to Council on R4. And I'll just conclude by asking Mr. James to comment on the minor nature and the basis of the staff recommendation.
Yes, thank you, Mr. Mayor. It's Doug James here. With respect to the proposal, the staff did evaluate it, and with respect to the policies of the official plan for intensification, we found that the nature of the variances or their performance standards for the subject property did meet the intent of those policies, and that it was good infill, lots of green space on the property as a whole. It is providing 2 parking spaces. There was an issue with respect to the stairs on one of the side yards. The stairs are allowed in the side yard, and through the site plan control process, the issue of the stairs with the screening of those from the neighboring property, we can look at that to mitigate the impact of those stairs. As well as with respect to the parking, there was an issue too, Mr. Mayor, with the permeability for surface water runoff, and because that is an issue that is within Kitchissippi Ward, but through the site plan control process, that too will also be looked at. So in total, we found that the proposal did meet the official plan policies and represented good infill.
Okay, so we have a recommendation from committee for 25 Grant Street, modification de règlement de zonage 25 rue Grant. Carried.
Yeas, please, Mr. Mayor.
Yeas and nays.
Please, Mr. Mayor.
Yeas and nays have been called. Sorry, yeas and nays have been called. So this is the committee recommendation. If you support the committee recommendation, it's yes. If you don't, it's no.
Councillor El-Shantiri.
Yes.
Councillor Eglai.
Yes.
Councillor Tierney.
Yes.
Councillor Gower.
Yes.
Councillor Derouse.
Yes.
Conseil Fleury.
No.
Councillor Hubley.
Yes.
Councillor Menard.
No.
Councillor Dudas.
Yes.
Councillor Meehan?
Yes.
Councillor Shirelli, Councillor Luloff?
Yes.
Councillor Kavanagh?
No.
Councillor Moffat?
Yes.
Councillor Suds?
Yes.
Councillor McKenney?
No.
Councillor Brockington?
Yes.
Councillor Leeper?
Sorry, no.
Councillor Deans, Councillor Harder?
Yes.
Councillor King?
No.
Conseil Cloutier?
Oui.
Mayor Watson?
Oui.
15 yeas, 6 nays.
Okay, so that item carries. Next item is bulk consent agenda. We have a request to remove item number E. Does anyone else wish to remove anything from the bulk consent agenda? So on the bulk consent agenda, minus item E, carried?
Carried.
Any dissents?
Carried.
Any dissents? So Councillor Fleury, you have a technical amendment seconded by Councillor Harder. If you'd like to introduce it, please. Councillor Fleury.
Yes, thank you, Mr. Mayor. This is a motion brought forward by staff, whereas Planning Committee at its meeting of April 9, 2020 approved the following recommendations in respect to report ACS 2020 PI PS 004 titled City Resolution for 263 Greensway Avenue. That Planning Committee recommend to Council that by declaration of resolution under Section 45 of the Planning Act, an application to the Committee of Adjustment be permitted in respect to the property at 263 Greensway Avenue for minor variances associated with the proposed development, limited to the number of parking spaces permitted, and whereas it has come to staff's attention that the disposition section of this report had not been completed, therefore be it resolved that Council approve the addition of the following text as the report's disposition. The Office of the City Clerk will communicate Council's decision to the property owner. Be it further resolved that pursuant to the Planning Act, subsection 3417, no further notice be given.
Okay, on the amendment, carried?
Carried.
Any dissents? On the motion as amended, carried?
Carried.
Any dissents? Okay, thank you. Merci. Councillor Moffat, motion to adopt reports, motion portant adoption de rapport, seconded by Councillor Dudas, please.
That Planning Committee Report 22 and the reports from the City Clerk entitled Ward 19 Cumberland Vacancy Options and Summary of Oral or Written Submissions for items subject to the Planning Act explanation requirements at the City Council meeting of April 8, 2020 be received and adopted as amended.
On the motion, carried, adopté?
Carried.
Any dissents? No? Okay. Next, motions of which notice have been previously given. Motion dont avis a été donné entièrement. We have Councillor Tierney moving this, seconded by Councillor Dudas. So, Councillor Tierney, if you'd like to introduce your motion, please.
Great. Thank you very much, Mr. Mayor. Whereas Blair Road between Meadowbrook Road and Innis Road is currently a congested two-lane roadway and a major north-south arterial road in the East End, whereas approximately 430 buses to and from Blair LRT station headed along the south of Blair Road currently travel in mixed traffic, which causes delays and congestion, whereas the widening of Blair Road to establish transit priority lanes support the city's strategic objective to deliver sustainable transportation investment, improve transit services, and increase transit ridership, whereas the plan for the Blair Road widening is included in the Brian Colburn Cumberland Transitway environmental assessment, whereas the city is committed to complete the Brian Colburn Cumberland Transitway EA study to resolve the urgent commuting needs of residents in the growing East End urban community, whereas Brian Kohlberg Cumberland Transitway project is more complex and largely the relatively straightforward Blair Road widening project, whereas the complete EA is required prior to implementing any of these major transportation projects, whereas separating the two studies would position the Blair Road Transit Priority Project to be ready for implementation sooner, would not constitute piecemealing in accordance with the Environmental Act of Ontario, whereas carrying out the Blair Road Widening Project as a separate EA study requires approval from Transportation Committee. Therefore, it be resolved that staff would be directed to separate the Blair Road Widening for Transit Priority EA study from the Brian Colburn Cumberland Transitway EA study so that the Blair Road portion becomes a standalone project, and EA study be it further resolved that Blair Road Widening EA study assesses options for combined transit HOV lanes to address the pedestrian and cycling infrastructure to the Blair Road LRT station. And just to wrap it up, Mr. Mayor, this road is essentially like a rural road. It's a major pinch point for all our bus movements, as well as it's very, very unsafe for pedestrians. There's no sidewalks, so it's quite dangerous. This is staff supported, and I will reiterate, this is not queue jumping, and I'll certainly expect staff will also make mention of that. And I have consulted very heavily with the East End cycling groups. They're very excited about this. This will actually fix a major issue as well. Thank you, Mr. Mayor.
Okay, thank you. Does anyone else wish to speak to this motion? So we have a move by Councillor. Sorry?
Questions? Yep, questions, Councillor Leeper.
Yeah, okay, Councillor Leeper, go ahead. We have Vivi Chi is on the line if you have any technical questions.
Thank you. So I think the key question I have is why now have a Transportation Committee meeting coming up? Why is this being brought as a motion to Council without a staff report?
Councillor Tierney, do you want to answer, or Ms. Chi, or Mr. Willis? Sorry, Councillor Tierney, did you want to answer the question? It's your motion.
Certainly, Mr. Mayor. We've been working with staff for quite a period of time on this, along with Councillor Dudas as well. The real problem that we really see here is the Brian Kohlberg project. As we know, there's some NCC challenges and things that are happening. And in regards to Transportation Committee, certainly I would have loved to see this be there, but there are a lot of things happening at the same time here, and to delay this by a few months would take away from, obviously we have some timings coming up in regards to the TMP as well, and this all kind of fits together, but I'll ask Vivi if she can find the unmute button to comment on this.
Oh, hello. So this is a motion, so it doesn't require a staff report. This work is already underway, and it's combined with another study, so we're just doing an administrative splitting of the two files. That's all of this that's required here, so the motion is appropriate and doesn't require a staff report. Thank you, Mr. Mayor.
Councillor Leeper, anything else?
Yeah, so the piecemealing piece is something I'm interested in. It's I am new to the concept of piecemealing the EAs. I'm wondering if I can get a description of what would not be allowed and in whose opinion this proposed approach doesn't constitute piecemealing.
Mr. Mayor, piecemealing is when you do one project independent of another, but then it would affect the outcome of the other study. We've looked at this. The Brian Coburn all comes into to Blair at the south end at Innis. There are no other options, and that's what we've been looking at. Sorry, that's if we're going up to the north, there could be other options looking further south. But what we're doing here with this project for Blair Road Station Transit Priority does not impact on the outcome of other works, and that's where. That's why we've concluded that it's not piecemealing. Because through the EA Act, Ontario EA Act, the idea is the reason behind it is if you have a project, you have to look at all of the impacts rather than breaking them up into little compartments or separate projects, which then you don't see the overall cumulative effects. Whereas in this case, we don't see that happening at all because they are very independent of each other and they can work together as well.
So in November 2019, the EAA was expanded to go from Meadowbrook to Blair. And that makes a lot of intuitive sense to me since you're going to want to adopt the same kind of profile on the street, understand the impacts from the one end to the other. Why can't we study just the Meadowbrook to Innis without understanding the implications for the Meadowbrook to Blair Station? Surely those are linked.
Yes, they're together, and we're trying to get everything from on Blair from Innis all the way through to make the connection up to the transit station at Blair, the LRT station.
So shouldn't that be studied as a single process? No.
So, I'm sorry, Councillor Tierney, do you have a comment about that? I'm sorry, I'm taken aback by this question because I think they're together within the same area, are they not?
Yes, that is correct. I'm sorry, Jeff. I fail to understand what your question is. Are you talking about the connectivity right to the station all the way through?
Yeah.
Yeah. Yeah, and as a matter of fact, there has been a lot of work done on that as well, especially on top of the bridge that goes over top of the highway. A lot of those lane reconfigurations are part of a lot of the discussions that have taken place to date. It is very dangerous right now for cyclists going over top of that bridge, and certainly that is one of the objectives of this Blair Road connector.
Okay, anything else, Councillor Leeper?
Okay. No, Mayor, I'll leave it there. Thank you.
Okay. So on the motion by Councillor Tierney, seconded by Councillor Dudas, carried?
Carried.
Carried.
Any dissents? Okay. Next is motions requiring suspension of the rules of procedure. Motion exigeant la suspension des règles de procédure. The first item we have is Councillor Dudas, seconded by Councillor DeRuse, a procedural matter. So on suspension, carried?
Carried.
Dissents? Carried. So Councillor Dudas, do you want to just, I guess, read the therefore be it resolved, because I think everyone has a copy of it, and Tim Mark is available to answer any questions. Councillor?
Certainly, Mr. Mayor. Therefore, be it resolved that the Council approve the following additional amendments to Procedure Bylaw number 2019-8 to remain in effect while the emergency declaration set out in order in Council 5/18/2020 remains in effect. Number one, more than 2 regular meetings of Standing Committee Commission may be cancelled if, in the Chair's opinion, such meetings are not necessary for the proper conduct of the business of the Committee Commission or convened as special meetings as provided for in Council Motion 31 of March 25th, 2020. And number 2, that the means of electronic participation for future meetings of Council and Committee Commission may be by telephone or other electronic means as may be communicated to members and the public in advance of the meeting, including the process for members of the public to participate electronically Committee Commission meetings by means of written and or oral submission.
Okay, thank you. Any questions by members of council? So on the motion?
Mr. Mayor, I have a question.
Sorry, Councillor Fleury, go ahead.
So I wonder, the previous item is a good example of, there are probably no issues, but it would have been nice to get a presentation. And I listen in to, I'm not a member of Planning Committee, but thought that Planning Committee was quite effective meeting virtually last week. And I wonder, obviously it's pending resources, but if we can work with the clerk to try to meet as regularly as possible virtually, which has appeared to be effective for Planning Committee, for example.
Yeah, I think that's a good point, and I think that's part of item 2 on the recommendation. So thank you for that. So on the motion, carried. Any dissents?
Carried.
The next motion requiring suspension of the rules is moved by Councillor Harder, seconded by Councillor El Shantiri with respect to the Committee of Adjustment and their duty to carry on meetings. So on suspension, carried?
Carried.
Any dissents? So, Councillor Harder, do you want to introduce your motion, please, on the Committee of Adjustment?
Certainly, Mr. Mayor, and earlier today in our inbox, coincidentally, we received a note from the Committee of Adjustment telling us about the situation they were in during a state of provincial emergency. So what this does is because they haven't been able to operate and they haven't been holding their hearings, we find that it's appropriate for Council to authorize an electronic meeting of the entire Committee of Adjustment, sitting as Committee of the Whole, to meet electronically so that in that role they can consider the purposes of considering revisions to its rules of procedure. It allows them to move forward.
Okay. On the recommendation, carried.
Mayor, Councillor Leeper. Mayor?
Sorry, Councillor Leeper. Yeah, go ahead.
So if I may ask, what about public participation? The rules here would say that they could sit and meet electronically for the purposes of considering revisions to its rules of procedure. Is there a way in which we can ensure some public participation in that?
So, Mr. Clerk, is that, I'm assuming they would have the same technology that we would have available to allow the public to participate, Mr. O'Connor?
Mr. Mayor,
it's Tim Mark, sorry. Yeah, go ahead, Tim.
Mr. Mayor, so yes, they will be taking an approach that would be, we anticipate to be similar to the Planning Committee that they are going to be taking with respect to allowing public participation. But there is, in fact, a provision in the Statutory Powers Procedures Act which allows a person, if they believe this should be done by an in-person hearing as opposed to an electronic hearing, to register their complaint, and the committee would have to consider whether or not it would be more appropriate to deal with it in an in-person hearing.
Okay, that's good to hear. Councillor Leeper, anything else?
Well, I am just wondering if the mover would be open to a friendly amendment to make it explicit that it would be sitting as a committee of the whole to meet electronically, including public participation for the purposes.
So what sentence are you wanting to amend, Councillor Leeper?
So in the resolution, therefore be it resolved that the Council of the City of Ottawa authorizes the Committee of Adjustment of the City of Ottawa, sitting as a committee of the whole, to meet electronically, including with public, or on condition of public participation for the purposes of considering revisions to its rules of procedure.
Tim.
Mr. Mayor, Councillor Fleury.
No, just a second. Tim Mark, could you comment on that? Because I don't quite understand how it would change, because to meet electronically, you are receiving public input.
Mr. Mayor, what I understand the Council's motion to be saying is that he's asking that not just that the hearings themselves be open to the public, which is an absolute necessity, but that in considering its revisions to its rules of procedure, the committee accept public submissions, which isn't a statutory requirement. That's what I believe the Council is asking.
Sorry, to submit, to receive public delegations, but not in person, unless they ask.
Yes, Mr. Mayor. It would be like on March the 25th, Council had accepted public submissions on how it should change its rules of procedure to deal with the emergency. That is what I understand the Councillor is asking.
Councillor Harder, are you okay with that? Councillor Harder?
As long as it's not illegal and Mr. Mark says that it can be done, I don't have a problem.
Okay, so that's a friendly amendment. Okay, so...
Mr. Mayor?
Yeah. Councillor Eli Al-Shantiri?
Yes.
Is that going to have any impact or any delay? Mr. Mark, can he help us with that? Is that a friendly amendment to Mr. Mark to move forward with it?
Yeah, it's a friendly amendment to Councillor Harder. Mr. Mark, just for the benefit of the people listening, and Mr. Tim Mark is on the line. He's one of our senior lawyers. Mr. Mark, is this going to, first of all, is this legal? And secondly, will it delay any of the proceedings at the Committee of Adjustment, in your opinion?
Mr. Mayor, I might invite the Deputy Clerk to make a comment. Is it illegal? No, it is not, Mr. Mayor. Might it require a few extra days to get it set up so that the committee can take submissions from the public? The Deputy Clerk might be able to speak to the skill set that is required in order to accommodate that. But in the end, the committee would have had to do it anyway for the individual panel meetings.
Okay. So, Deputy Clerk, you're in agreement with that?
Yes, Mr. Mayor, I understand the Committee of Adjustment will be following the city's lead in terms of what we are doing for the Joint Planning Committee and ARAC meeting scheduled for the second week of May, and would be taking public participation following that.
Okay, so I think I heard Councillor Fleury. Do you have something to comment on this, Councillor? You don't have to.
No, Mr. Mayor, I just was speaking up if he needed a seconder for that.
Okay. Okay, so on the motion, as amended, well, it's a friendly amendment, so we don't have to say that. Carried?
Carried.
Ad update. Any dissents? Okay, thank you. The next motion requiring suspension of the rules is by Councillor Brockington, seconded by Councillor Eglai, with respect to allotment gardens. On suspension, carried?
Carried.
Any dissents? Councillor Brockington, if you'd like to introduce your motion, please. And I guess Councillor Eglai also brought a similar motion to the Health Board as well, I believe.
Yes, that's correct, Mr. Mayor, and I won't read the whereases. I think it's fairly self-explanatory, but I would like to provide a very brief comment. I think we can all agree that community gardens across the city provide multiple benefits to residents and organizations who plant vegetables and herbs and other plants. People do this because, frankly, they need to grow their own produce. They use it for their own families, provide it to communities and persons in need in communities, and there are a number of community groups that grow food which they then give to other individuals and groups in need. This is not about providing people opportunities to conduct their hobbies. This is really out of necessity, and I want to thank Chair Eglai for his work on the Board of Health. Board of Health passed a motion the other night, and appreciate him seconding today's motion. Certainly many groups and individuals in my ward, from family houses that grow food for people who live in social housing to people who do not have backyards, the many apartment dwellers in my ward and across the city who do not have the physical capacity to grow food that the community gardens provide this service for. So this can be done by respecting physical distancing, and I hope that the municipalities and other groups that have been contacting the province lately allows that to sink in. I'll just say in River Ward, both MPP Fraser and Hardin have also sent letters to the province supporting this initiative, and I hope members of council support this today.
Great, thank you. Just as a happenstance, I was speaking with Premier Ford last night, and this was one of the issues I raised with him, and explained to him how important these allotment gardens, community gardens, are to different neighborhoods. And he was certainly very empathetic about our request that we allow the community gardeners to get in there to start planting and weeding and harvesting their food products. So hopefully this motion, which we'll send to him today, will reinforce my conversation with him, but he was very understanding when I brought up the issue. So thank you, Councillor Brockington, and thank you, Councillor Eglai, for bringing this forward.
May I make a comment?
Sorry, who's that?
Councillor Kavanaugh.
Oh, sorry, go ahead.
Thank you very much. Yes, I'm very supportive of this, and I just want to point out the importance, because when we talk about our private properties and our own backyards, we can do a lot of things, and that's been a problem in terms of having closed parks, et cetera, because people who don't have those private spaces, such as backyards, can't take advantage of parks. Well, it's the same thing with community gardens. There are a lot of people out there that don't have those public private spaces, so they need these public gardens. And with the growing season coming up, it would be a shame not to be able to have these people grow their own food. A lot of support in Bayward on this. Thank you.
Great, thank you. So someone is pushing a number of buttons on their phone. If they could stop doing that, please. Thank you. Merci. So on the motion, carried?
Carried.
Any dissents? No? Okay, thank you. The next motion requiring suspension of the rules of procedure is to provide a private approach to parking. On suspension, carried?
Carried.
Councillor Menard, if you'd like to, any dissents on that? Councillor Menard, if you'd like to introduce your motion.
Yeah, thank you very much, Mayor. I'll just read the be it resolved that in respect of the reconstructing of Fairbairn Street, Belmont Avenue, Willard Street, and Bellwood Avenue, private approaches be reinstated as they were immediately prior to the reconstruction of these streets. It's similar to Councillor Aguilar's motion last meeting, and I personally walked these and worked with staff on some of these private approaches. There's not many, and most of them are in the 50s and 60s, so hopefully get council support on this. Thank you.
Okay, on the motion, carried?
Carried.
Any dissents?
Carried.
No dissents, okay, thank you. The next item requiring suspension of the rules is community shout out in support of healthcare providers and essential workers during COVID-19. Moved by Councillor Kavanagh, seconded by Councillor Leeper. On suspension, carried?
Carried.
Any dissents? Oh, Councillor Kavanagh, if you'd like to introduce your motion, please.
Thank you. Lost track if I'm on mute or not mute. Can you hear me?
We can, yes.
Okay, thank you. Thank you for this. This is just an extension of what we've already passed. We're getting a lot of support for it, and clearly this is going to go on for a long time, and we need to continue to speak out on how important this is. This is also important in terms of the socialization it provides, because when people interact with each other and talk about doing a shout out together, it's another opportunity to work together. And we don't have many opportunities to reach out to our neighbors, and so this is very important. We need this for our mental health as well. Just a feeling that we're doing something and that we're continuing to put up our keeping our spirits up. So thank you very much for your support on this. Here.
Great, thank you very much, Councillor. And all those in favor, carried? Carried. Any dissents? Are there any other motions requiring suspension of the rules of procedure? Notice is a motion for consideration at subsequent meeting avec des motions pour examen en réunion subséquente. Councillor Cloutier, seconded by myself with respect to the selection process for the Auditor General. Councillor Cloutier, if you'd like to introduce, please, your notice of motion.
Thank you. Thank you very much, Mr. Mayor. Just want to tell members of council that as chair of the audit committee, I'm giving notice that I'll introduce a motion at the next council meeting to begin the process to select the successor for the Auditor General. The Auditor General was appointed in December 2013, and his term expires in December 2020. He's done an outstanding job, valuable work of auditing work at the City of Ottawa, and at the end of and we need to begin the process to find a successor for that important work.
Okay, thank you. So we'll deal with that at our next council meeting. The next notice of motion is by Councillor Menard, seconded by Councillor Leeper, please. Councillor Menard, if you'd like to introduce the motion that will be dealt with at the next council meeting.
Yes, thank you very much, Mayor. It has to do with a change in the Section 37 of the Planning Act funds for a particular property in the ward. Whereas, I'll go through the whereas. Whereas bylaw 2017 was enacted by Council on February 8, 2017, and directed by the owner of the land at 265 Carlin to enter into an agreement pursuant to Section 37 of the Planning Act to be registered on title to the satisfaction of the City Solicitor and General Manager, Planning, Infrastructure, and Economic Development to secure an amount of $204,581.25. And whereas 100% of the required funds were directed to improvements to Eugene Forsey Park and Dalhousie South Park, as detailed with Part 19 of Bylaw 2008-2050, and whereas no further improvements are needed at this time for that park beyond $157,000 presently allocated for park upgrades to this park in the 2020 city budget, and where it is estimated that improvements to Eugene Forsey Park can be accommodated within a budget of $100,000, and whereas the parties entered into aforementioned Section 37 agreement, which was registered on January 10, 2017, but the funds have not yet been paid to the city as development in respect of the property has not commenced. And whereas it is at the request and direction of the Ward Council to have 51% of the above funds redirected toward affordable housing within Ward 17, and whereas it is at the request and direction of the Ward Council that the remaining 49% of the funds will be directed to improvements at Eugene Forsey Park, and whereas the Section 37 agreement may be amended upon consent and approval of the owner and the city, whereby such approval has been granted by the owner, therefore be it resolved that Council approve an amendment to instrument number OC1859698 to provide for the redistribution of the anticipated funds in the following manner: $104,581.25 be directed towards Ward 17 affordable housing, and B, $100,000 be directed towards Eugene Forsey Park improvements. Be it further resolved that such amending agreement be registered on title to the lot to the satisfaction of the City Solicitor in consultation with the GM Planning, Infrastructure, and Economic Development. Thank you.
Okay, thank you. Next notice of motion is by Councillor Leeper, seconded by Councillor King. Councillor Leeper, please.
Thank you, Mayor. This one with respect to the opening of outdoor spaces, safe active transportation spaces outdoors, that we directed staff to start working on at our council meeting a month or so ago. I know in my case, I've had a very successful closure to all but local traffic on Byron, but we are going to start hitting a hurdle with respect to trying to fund those, so long as they are required to be funded entirely from ward councillors' budgets. I'm looking at trying to work with staff on some other creative funding options. So I'll just read therefore be it resolved, which is that the direction to fund pandemic-related temporary extensions of active transportation space inclusive of accessing essential services solely through ward councillors' budgets be removed, and that councillors may work with staff to identify opportunities for further implementations, including identifying any appropriate funding sources not restricted to their ward budgets.
Okay, thank you. Motion to introduce bylaws. Motion portant présentation de règlement. Councillor Moffat, please. Seconded by Councillor Dudas.
Thank you very much. That the bylaws listed on the agenda under motion to introduce bylaws, 3 readings, be read and passed.
Carried. Any dissents? Confirmation bylaw, règlement de ratification. Councillor Moffat and Dudas, please.
That the following bylaw be read and passed to confirm the proceedings of the council meeting of April 22nd, 2020.
Carried. Adopté. Any dissents? Inquiries. Councillor Moffat has a notice he'd like to inform members of council and the public on. Please, Councillor.
Thank you very much. Yes, as many are aware, when we closed our city facilities, the Trail Road Waste Facility was also part of that closure. Just wanted to, the public and the members of council will get a notification today that the Trail Road Waste Facility will be reopening tomorrow, Thursday, April 23rd. It'll be open from Monday to Friday from 7 a.m. to 6 p.m., except this week we will be open Thursday, Friday, and Saturday. Saturday will be open from 7 a.m. to 6 p.m., but from that point forward, it will be closed on Saturdays, it's just a different additional safety measure that are trying to put in place, just difficult to operate 6 days a week. So if people have been to the site, they are aware the scale house does have public interaction. So it took some time to implement some safety measures at the facility in order to keep our staff safe that are there day in, day out. So that's now been done, and it's ready to be open. So that'll happen tomorrow.
Okay, thank you for that. Any other inquiries, Madam Deputy Clerk? Councillor Moffat, adjournment, please. Seconded by Councillor Dudas.
Thank you again. That the proceedings of the City Council meeting of April 22nd, 2020 be adjourned.
Carried. Adopté. Any dissension? No. Thank you. Meeting adjourned, and the press availability or media availability will commence at 1:30 in the Council chamber and also be available on the YouTube channel, I believe, for the City. Thank you. Merci.